Can you see them?
Yes, perfect. Yeah. Okay, great.
Good afternoon, colleagues, and greetings from Addis Ababa and the Africa Centers for Disease Control and Prevention and the African Union Commission. And we would like to get this very important meeting going. And I would just like to welcome everybody and acknowledge the very strong cooperation and partnership that has led to this moment, this 2 days meeting. I would really like to personally thank our colleagues from the Medical Research Council in South Africa under the leadership of Professor Glenda Gray, whose office and our office have been working very closely for a couple of weeks or months to get this very important meeting going. Let me also thank the staff at the Africa CDC for the tremendous work they have been working behind the scene very quietly together with our colleagues from the Medical Research Council in South Africa. Today, we are here to discuss a very important topic. We are in the middle of a pandemic, and vaccines is central. For those who have been following the conversation the last couple of days, you actually notice that it has dominated the media significantly, and rightly so. The time that we all talked about solidarity, cooperation, and true partnerships to scale up vaccines is now. And we have to move from warm words, words that says the right thing, to actually the implementation. Our people are watching the world as vaccination starts in Europe and the United States and other parts of the world. I think they are watching us closely and asking the questions, when will we have vaccines on the continent? So I think it is with pleasure that I would like to introduce Commissioner Amira El-Fadi, who is the Commissioner of Social Affairs, to welcome us with her remarks. She has been a champion all through this battle since January, and she was here with us and actually presided over the first meeting we held on the 24th and 25th of June under the very able leadership of President Cyril Ramaphosa, Chair of the African Union, and our chairperson of then. We have developed a continental strategy for vaccines, and where we presented it on August 20th at the Bureau of the Head of States, and it was endorsed. So I think without much ado, let me invite Commissioner El-Fadi to make her introductory remarks, and then we'll follow through with Honorable Minister of South Africa, Honorable Dr. Zweli Nkezi. Excellency, Commissioner Amira, over to you.
Thank you very much, Dr. John. My greetings to the ministers present in this meeting, and also to the co-chair of our ministerial coordinating committee, Dr. Zweli, Minister of Health of South Africa. Welcome to this very important meeting at this very important time, while we are joining our efforts together to fight COVID-19. I would like to start by giving the greetings of the African Union Commission in Addis Ababa, and also the greetings of His Excellency Moussa Faki Mohammed, the chairperson of the African Union Commission. And I would like to convey my warmest greetings and welcome to all of you here today in this virtual conference to discuss the fair, equitable, and timely allocation of COVID-19 vaccines in Africa. I would like also to recall that either earlier this year in June, the Africa Centers for Disease Control and Prevention hosted a 2-day virtual conference to discuss Africa's leadership in the development and access to COVID-19 vaccine. And Dr. John just mentioned these 2 days meeting in June, and that there is the number of the participants exceeded 3,000 participants from all around the world, and most of them are experts in the area of vaccines, different stakeholders, and it was a very successful 2 days conference on vaccine development in Africa. As a result of this conference, the Africa CDC developed the Africa Vaccine Development and Access Strategy, focusing on 3 key objectives. I would like here to stop just for a minute to say that this meeting, in this meeting, we have been honored by having our chair of the new union in the opening of the meeting, His Excellency President Ramaphosa, and also our chair of the commission, His Excellency Musa Faki, Dr. Tedros, and many other global entities. They attended the meeting. The 3 objectives of this strategy: 1 is to accelerate African involvement in vaccine development by facilitating COVID-19 vaccine clinical trials in Africa. The second objective is to secure Africa's access to sufficient vaccine supply by ensuring financing and procurement of COVID-19 vaccine. And for this purpose, also the chair of the union with the chair of the commission, they have established this new mechanism, AVAT, and AVAT is the African Vaccine Acquisition Task Team, chaired by His Excellency Ramaphosa, and with the membership of Excellency Musa, and also with the private sector involvement, Strife Masewa, Professor Orama, Donald Kabroka, many participants, and it's still open. Dr. Zoel is a member, myself is a member, Dr. John is a member of this task team, and this task team is now leading the negotiations on the issues around vaccines and the availability, accessibility, and affordability of vaccines to Africa. The third objective is to remove barriers to vaccine delivery and uptake by helping to facilitate harmonized and timely regulatory delivery and uptake processes. For the purpose of this meeting and the discussions, because we need this even collaboration after COVID-19, I would like to say that I'm taking this opportunity to say that please, member states, accelerate the processes of signing and ratifying Africa Medicine Agency Treaty. It's very much needed in Africa. We are looking to make sure that this agency, it will be established during 2021. It is very much needed, as I said. We need it as a twin sister to Africa CDC. Excellencies, I would like also to recall that at the 20 August 2020 meeting of the Bureau of the Assembly of AU Heads of State and Government and the chairperson of the AU Regional Economic Communities, the REX, AU Heads of States and Government stressed that Africa should take appropriate measures as part of the strategy to ensure that it secures timely access to COVID-19 vaccines when they become available. And that's why we have this now task team. It's working on implementing this decision from our Bureau of Heads of States and Government. By our estimates, vaccines or vaccinating 60% of the African population is expected to cost between 10 to 15 billion dollars. And this is a challenge for us in Africa. We have reached a critical point in time in the pandemic in which Africa must have its voice heard, not only to assert, but to aggressively act on its plan for ensuring vaccines for its citizens in order to slow transmission of COVID-19 and to reduce the socioeconomic burden of the pandemic or the pandemic has caused in Africa. Excellencies, dear participants, over the course of today and tomorrow, this high-level consultation will help us develop a framework with the African context in mind, which will guide fair allocation coupled with timely and equitable access of COVID-19 vaccines across our continent. It is my hope that Africa will come out of this pandemic with a stronger and with more harmonized vision for safeguarding Africa's health and also for the health and well-being of our African population, and also having more resilient and more strong health systems in Africa. Excellencies, dear participants, sorry. Sorry for this interruption. At this time, I would like, after thanking you for listening to these opening remarks and thanking Dr. John and his team for organizing this very important today's meeting, I would like to call upon my brother, Dr. Zweli Makizi, the Minister of Health of the Republic of South Africa, to provide his opening remarks. Thank you again. Shukran jazilan.
Thank you so much, my sister, the Commissioner for Social Affairs, Commissioner Amira El-Fadl, the AU Ministers of Health and of Finance and Excellencies present, Dr. John Kengasong, then the leader and the team from the Africa CDC. Thank you very much for your leadership, together with Commissioner Amira. Throughout this COVID era, we have had a lot of support from you and the coordination that you have played. You please keep up that good work. Professor Glenda Gray, the CEO, and other representatives of the South African Medical Research Council, representatives from the World Health Organization, business leaders, civil society, and various delegates who we have here, researchers, ethicists, and other members of our various institutions who are here today. Ladies and gentlemen, good afternoon, or good morning. It is a great honor for me to speak on this very important virtual conference to discuss the framework for fair and equitable and timely allocation of COVID-19 vaccine in Africa. It is a fact that COVID-19 knows no boundaries and respects no one. As a result, therefore, the distribution of COVID-19 vaccine needs to be fair, equitable, timely, and in order to save the lives of our people, no one should be left behind. The continent of Africa has recorded over 2.271 million COVID positive cases and 54,000 deaths in its 55 AU member states since December 2020. About 84% of the member states continue to report community transmission, and between 30th of November and 6th of December, we recorded 99,574 new COVID cases. Even though some of the regions have higher numbers recorded than others, it actually has to be noted that we're all still affected. In this continent, there are about 16 countries that are reporting case fatality rates that are higher than the global case fatality rate of 2.3%, and South Africa is one of those that have got fatality rate of 2.7%, indicating we are indeed not yet over the COVID-19 pandemic. Africa and indeed the world is looking forward to a time when it can return to normal. Vaccination is considered the most effective intervention to protect those most vulnerable to the disease and to interrupt the spread of the virus. Vaccination, combined with other measures, mitigates the impact of COVID-19 on public health and will assist in the revitalization of our economies. It's anticipated that the access to a safe and effective vaccine will help us to achieve the return to normality. The establishment of COVAX facility, which is co-led by Gavi, the Coalition for Epidemic Preparedness and Innovation, CEPI, and the World Health Organization, working in partnership with developed and developing countries' vaccine manufacturers. COVAX aims to accelerate the development and manufacture of COVID-19 vaccines and to guarantee fair and equitable access for every country in the world. In the short term, the COVAX facility is a means to access vaccine to protect those most at risk and vulnerable in our society. Whilst we commend the pace at which the vaccine development has taken place, excuse me, there is a concern that commitments are being made even before the performance of the vaccines under the study at the moment is known. There are numerous clinical vaccine trials taking place with over 200 candidates vaccines under investigation. Preliminary data from some of the trials gives us a hope that a safe and effective vaccine will soon be available. We'll encourage and support vaccines research in our own country so that the efficacy of the vaccine in our own context can be determined before we make a large-scale investment in implementation. Excellencies, ladies and gentlemen, we're aware that some countries have started with the vaccination programs and the African continent cannot be left far behind. There are a number of issues for consideration, such as the following: the reality that the demand for vaccine far outweighs the supplies available. If we consider Africa's population to be about 1.3 billion people, and if we further consider that over 60% of the population will need to be immunized to achieve herd immunity, then approximately 750 to 780 million doses will be required for Africa alone. From what we know, it's estimated that only 200 million doses of vaccine will be accessible through the COVAX facility. It is clear from these numbers that the COVAX facility is just one of the options that we as African countries must consider to access vaccine. Certainly the beginning, but it's not the end. The COVAX facility represents the vaccines pillar of the ACT Accelerator, which aims to accelerate the development and manufacturing of a vaccine while promising fair and equitable access to countries that take part in the COVAX facility. As African countries, we face unique threats to vaccine access. The African Union consists of what is known as self-financing countries, such as South Africa and about 6 others, and then the countries that will receive subsidized support to participate in the COVAX facility. However, even this subsidized support will only ensure access to limited doses, which at best could cover about 20% of the population. Excuse me. Herd immunity requires much greater population coverage, and will soon convene meetings, therefore, of ministers to explore the alternatives that are available. Readiness of our supply chains to acquire, store, and distribute the vaccines. Being specialized biological commodities, vaccines require cold chain storage to maintain its integrity so that quality vaccines are administered to our people. Many of our countries' supply chains will therefore require significant investment to support large-scale rollout of the medicine. For self-financing countries such as South Africa, with no subsidized or philanthropic support, access may even be more limited. Given the current economic climate and the available resources, South Africa has been able to place vaccines to cover 10% of the population as initial step. There will still be a huge expenditure that we must incur in organizing the logistical support to ensure we can reach out to the far-flung countries, far-flung parts of our countries. And that also means we have to plan specifically for that. The best we can do at the present is that we ensure that the administration of the vaccine, which will be done in phases, starts with the protection of the vulnerable groups, including our frontline workers and those who are likely to benefit from most from the vaccination. Another matter that requires focused discussion is the pricing of the vaccines. Many of the vaccines manufacturers have indicated that they will offer the vaccine at not-for-profit prices during the pandemic. The question to ask is why upper middle countries should pay the same as higher income countries who have significant more resources. High prices are a barrier to access. This has been a topical discussion in many fora. Governments around the world and donor organizations have made significant investment into the research and development in order to expedite access to vaccines. A reasonable expectation would be that the vaccines can be acquired at a fair and affordable price for all countries. All the points mentioned above show that there's a huge need to mobilize resources in order for the African continent to be able to access vaccines to cover the 60% of its population for full immunity. Currently, vaccines have not been approved by any of the regulators except for Pfizer vaccine in the UK The data as it emerges will be used by the regulators to inform the approval process. We must, however, be vigilant of the safety issues which may arise and put the systems in place to pick up the signals early on. Excellencies, the likely requirement of a no-fault compensation scheme as outlined in the COVAX agreement and in discussion with individual manufacturers could further impede access to COVID vaccines in upper middle income countries, as these countries cannot afford the implementation of such a scheme and won't benefit from the solution offered by Gavi. But there is more. Whilst we participate in the COVAX facility in the spirit of social solidarity, vaccine nationalism has emerged as a threat to access. We know that our counterparts in wealthier countries, especially in the Northern Hemisphere, accounting for 13% of the world's population, have already committed to buying at least half of the global potential vaccine supply. This demonstrates the inequity that exists and that we are here to address. Participation in the COVAX facility is undoubtedly our best mechanism for accessing vaccines. Through COVAX, the chances of a successful development of a COVID-19 vaccine is maximized. COVAX has created the world's largest and most diverse portfolio of candidate vaccines, with 9 candidates vaccines currently in development and 9 more under evaluation. COVAX will support the manufacturer of the vaccines in the quantities to reduce the risk that countries, especially those in Africa, will go unprotected. Whilst participation in the COVAX facility should be supported, as the African Union, we should leverage this opportunity to develop our own similar pool procurement systems to ensure that we do have access to safe and effective vaccines when needed. In addition, we should engage with our global counterparts to develop collaborative approaches so that in crises such as this one, we can create policies and frameworks that leverage the strength of our African societies and ways of life. In his capacity as chairperson of the African Union, His Excellency President Cyril Ramaphosa established a COVID-19 African Vaccines Acquisition Task Team to lead the effort for acquiring and funding affordable and effective vaccines for the African region. This is part of what Africa should do beyond COVAX on how we can obtain additional vaccines. We look to the efforts to give meaning to the implementation of the Africa Vaccine Strategy. And Excellencies, allow me therefore to take this opportunity to appreciate the African Union Commission, the Africa CDC for their dedication and their endeavor to fight COVID-19 in Africa. I congratulate also the South African Medical Research Council for joining hands with Africa CDC in this battle in a collaborative manner. I also want to thank you for creating this enabling environment and for the opportunity to provide inputs towards a framework that will guide fair allocation, coupled with timely and equitable access of COVID-19 vaccines across the continent. We as participants also are committed to effectively contribute to all discussions outlined in the program. We commit to effective implementation of the plans, strategy, framework, and recommendations from the conference. I also thank you for the skillful identification of key participants. I am convinced that by the end of the 2 days, we'll be having an essential framework that guides our fair allocation of COVID vaccine to all AU member states. The timelines and strategies for equitable access of COVID-19 vaccines across the continent will be clearly outlined. We are ready to do what it takes to turn the situation around in Africa, not only for COVID-19, but to ensure that our resilience and readiness to meet any other future health crisis. Thank you very much. I wish you everything of the best in your deliberations. Thank you very much.
So Commissioner Mira, you want to...
Yes, Dr. John?
Speaker, that's, yes, speaker. And I think Professor Glinda Gray will be giving us an overview of details of what we mean by fair allocation. I think, let me just say that the purpose of this meeting, as we've heard from Minister Zweli and Commissioner Mira, is really to begin to make very specific determination as to who gets the vaccine, when do you get it, how do you get it, and where do you get it in a fair and equitable manner. I think those are the key questions we are here to address. And I think there's no champion other than Glenda, who has been in this struggle right from the beginning, who can give us a clear presentation and a roadmap and vision on how we get from where we are to where we need to be. I always say that we need to be on the right side of history. The history of this pandemic will be written, and the history will determine if we were collectively on the right side of history or not. This is vaccines will determine the future of our continent, both the development, economic development, and the health development of our people. So without much further ado, let me invite Professor Glenda Gray, the President and CEO of the Medical Research Council, to share her presentation. Glenda.
Okay. Hi, can you hear me?
Yes, we can hear
Are
you.
you able to hear me?
Welcome, welcome, Professor Glenda.
Are you able to hear me? I can't hear me.
In Addis, we can hear you.
Are you able to hear me? Just let me go back, get us back onto the.
We can hear you,
Are you able to hear us?
We can hear you, and we can see your slides.
Guys. Oh, can you hear me? Are you able to hear me now?
Yes, Glenda, we can hear you.
Okay, sorry. We had we just weren't sure if you could hear me. So thank you very much, Your Excellency, Ms. Amira Al-Fadal, the Honorary Minister of Health, Dr. Zweli Mkhize, Dr. John Nkangasong, and my fellow people from the AU, CDC, and the MRC. We're very happy to work with you in collaboration to develop an African framework that talks to equity and fair allocation. And as we've heard that before from our minister, is that Africa will require approximately between 750 to 1.5 billion doses of COVID-19 vaccines to achieve herd immunity and control of the pandemic on our continent. These doses, we've also heard, will have to be procured, allocated, and delivered to the target populations. Each of these steps will pose its own challenges and will require a strategic approach. There are global inequalities in vaccine access at the moment, and this could easily translate in delays of getting vaccine into Africa. Initially, we've heard there will be limited volumes and hence difficult decisions on prioritization and fair allocation will have to be made. We've heard also that various countries have had different strategies to talk about the fair allocation of vaccines. And I'm just going to mention two proceedings, one from the National Academy of Sciences from the USA, and they have looked at both ethical principles and procedural principles. And the ethical principles is to make sure that there is maximum benefit. And first and foremost, that is to reduce the risks of severe morbidity and mortality. There's also the principle of equal concern, that no one person is more valuable or worthy of consideration than another. It entails the treatment of all equals rather than automatically the provision of equal share. In terms of mitigation of inequalities, we also have to understand the vulnerability of people and the vulnerability of certain people in their health status, which means that these individuals will require consideration for access. In terms of procedural principles, there's the principle of fairness, transparency, and evidence base. And in terms of fairness, there needs to be a public acceptance of the allocation criteria, which have been based on ethical principles. The issue of transparency is the importance of working with communities to accurately detail how vaccine allocation is going to work in the framework with which has been designed. And obviously, there always has to be evidence-based. Is that there has to be evidence into who receives the vaccine, and it should be based on the best available evidence. There's also a position paper coming from Germany, from the members of the Standing Committee on Vaccination, the German Ethics Committee, and the National Academy of Sciences. And their strategy is around the prevention of severe cases of COVID-19, which is the hospitalization and deaths, the protection of persons with high who are exposed, so those are the healthcare workers, and the prevention of transmission and protection in environments where there's a high proportion of vulnerable people and those with a high outbreak potential, and essentially the maintenance of essential state functions and public health. So these are some of the considerations that have been touted. In Africa, we believe that the framework should be guided by African indigenous values and the principles of Ubuntu. And these principles are affirming the humanity of others, the survival of the community, the issues of social solidarity, and the meaningful community engagement. And in terms of affirming the humanity of others, we believe that allocation decisions must be for societal benefit and promote common good while respecting human dignity, that each person has equal dignity, worth, and value. Hence, allocation decisions must be non-discriminatory. Characteristics such as ethnicity, nationality, gender, sexual orientation, race, and religion are not to play a role in allocation decisions, and people are to be treated fairly and equally. Allocation decisions are to be impartial and in accordance with fair criteria. We believe that the other principle of Ubuntu is the survival of the community, and this is the issue around prioritization. And the overall idea here is to reduce the risks of severe morbidity and mortality caused by acquiring SARS-CoV-2, and that the allocation decisions should be based on the best available evidence, and that essential service workers, including healthcare workers, who have been on the forefront of the pandemic may be considered a priority, and also those at greater risk of severe illness and death are also a priority. In terms of social solidarity, we believe that allocation decisions should endeavor to, one, unify communities, take into account the economic, social, and personal disruptions and hardships experienced because of COVID-19, and also to ensure that the socially vulnerable groups are not left behind. We believe in meaningful community engagement. Allocation decisions must always be trusted. Community engagement is imperative because this allows for authenticity, trust, and ownership of the allocation decisions. Community involvement will be required for both allocation decision-making and addressing vaccine hesitancy. Faced with the challenge of maintaining public trust while simultaneously stemming the pandemic through various control measures, early engagement by decision makers with stakeholders is paramount, and the decision-making process should be fair, ethical, and transparent. We have been working with the AU and African CDC and the South African Medical Research Council's Bioethics Advisory Panel to look at this framework and propose a framework in terms of prioritizing vaccine rollout. And we do acknowledge the importance, as have others and my minister as well, of frontline healthcare workers who have been instrumental in the pandemic response and are at high risk of being infected while they've been responding to the societal need and are essential components for the survival of our communities. A high risk of infection and the risk of spreading infection to their families makes them a worthy recipient of priority. We also believe that our elderly and those at high risk of morbidity and mortality should also be prioritized in this framework. Including in this framework, we also believe that essential workers who are required for upholding societal functioning, like healthcare providers, teachers, workers in food supply chains, policemen, and those working in transport are also priorities. Research participants require a discussion around their prioritization, as well as those living in overcrowded settings and in multiple generation homes. We also believe that there may be value for younger adults to be immunized to decrease the community spread. Pregnant women are important people to identify, particularly pregnant women who are healthcare workers. And this should either be done after safety has been established or under the recommendation of a doctor. Certain EUAs have allowed for pregnant women to receive the vaccination in consultation with their obstetrician. I think that's an important thing. And lastly, students and scholars are also important to look at to enable their return to school and university and after safety has been established in these groups. So these are our framework, and we are looking very forward to working with you for the next 2 days to come up with a framework that we can work from within Africa. Thank you very much. for allowing me to talk today. I'm going to hand over to Ames.
Thank you, Glenda, and thank you to our first participants in the first session for such, I think, important messages. Greetings to our colleagues from the AU, our AU leadership, and greetings to Minister Mkhize from South Africa as well. We now move into our second session, and this session is on financing. So I'll just introduce myself. I'm Ames Dai from the South African Medical Research Council, and I will be co-moderating the session with Dr. Ahmed Umar, Deputy Director, Africa CDC. And this session is on mechanisms of financing vaccines. So the present COVID-19 pandemic, as we've all heard, has serious health, security, and economic impact for the continent. Vaccines are a potent public health tool, and Africa needs to actively engage in the development, evaluation, and access to vaccines. So it's basically, I'm echoing what was already said. And the only way we can end the pandemic is if we successfully immunize a critical mass of African people with one or several safe and efficacious vaccines. But for this, we need money as well. And Africa needs to be ready to finance, procure, and deliver the vaccines at scale as soon as possible. So to ensure African countries can access a sufficient share of the global vaccine supply, the Africa CDC's COVID-19 vaccine development and access strategy, which has already been alluded to, underscores that once safe and efficacious vaccines are available, member states need to be able to access them at scale. While the strategy encourages the AU member states to actively participate in and support the COVAX facility, which is planning to procure and equitably distribute vaccine doses to cover up to 20% of the participating countries' populations, in order to cover additional needs of our AU member states, the strategy foresees the possibility of further deals with manufacturers. This has also been alluded to in our first section. The strategy also covers the need to accelerate African vaccine production, and these activities are driven by the COVID-19 African Vaccine Acquisition Task Team, which was established on November the 7th, and we will hear more about this as we move into the session. But for all this, continental collaboration and coordination is critical if we are going to develop effective financing for acquisition of the vaccines. I just want to remind us of the shopping spree that we've seen with rich countries. Minister Mkhize also alluded to this. And these rich countries have passionately indulged in these shopping sprees. And some of them have actually purchased enough vaccines for 230% of their populations. While COVAX underscores equitable global access, countries that have signed into COVAX have also been shopping and concluding bilateral deals, not leaving much behind for billions in our lower income countries. And this, in effect, undermines the pact for global equitable access and allows vaccine nationalism to blow wildly in the winds of the globe. So what lessons are there from this behavior for us in Africa? We also need to look at accessing vaccines outside the COVAX, and this has been discussed already. But we should go about this in a coordinated and collaborative way. We need to steer away from individual countries in the region striking deals individually. Else, we too will be guilty of vaccine nationalism on the continent. And one of the objectives of this whole exercise these 2 days is also to look at how we could try to steer away from such behavior on the continent. So this afternoon, we hope to address some of these complex issues with our lineup of expert speakers. We have 3 speakers that will present first. This will be followed by a panel discussion where your questions will be addressed by the panel. Please remember to post your questions on the QA section. I'm also going to request that our speakers switch off their mobile phones or put them on silent. And also we all mute ourselves unless we are speaking. I will introduce the first speaker. After Professor Benedict Orama has presented, I will introduce my co-moderator, and he will then introduce the next 2 speakers. So to kick off the session, we have Professor Benedict Orama, who is president of Afreximbank. Professor Orama is the president and chairman of the board of directors of the African Export-Import Bank, the Afreximbank. As president of Afreximbank, Prof. Orama has grown the bank significantly and improved its global appeal and relevance to the African continent, including playing a leading role in the implementation of the African Continental Free Trade Agreement, which is the most significant multilateral development on the continent for decades. Under his leadership, the bank is supporting the harmonization of standards and the development of quality infrastructure across Africa as part of a wider industrialization and export development strategy. As chair of the board of trustees of the African Union COVID-19 Response Fund, President Orama is helping to coordinate grant mobilization and efficient utilization across Africa, as well as coordinating the procurement and distribution of medical supplies amongst African countries. Prof. Orama has received several honors and awards, including his recent decoration by His Honor Vladimir Putin, President of the Russian Federation, with the Russian State Award of the Order of Friendship in 2019. Also in 2019, he was bestowed with the Knight of the National Order by the Cameroonian government. And in the same year, he received an honorary Doctor of Science degree in agricultural economics from the Obafemi Awolowo University in Nigeria. In 2017, Prof. Orama was voted African Banker of the Year by the African Banker magazine. So I'm sure you will agree with me, we have a real expert in Prof. Orama who will address us on Afreximbank's innovative financing strategy for COVID-19 vaccine access in Africa. Over to you, Prof. Orama.
Thank you very much for the introduction, and let me begin by thanking the organizers for inviting me to speak today on a very important subject. A number of the things I wanted to say at the beginning have already been discussed earlier in the presentation, but I think it is important to still emphasize the damage that the COVID-19 pandemic is having on our continent. Please, can you move to the next slide, please? As you're all aware, within the continent, we've suffered more than 56,000 fatalities, with more than 2.3 million people infected. If you look at it from the global scheme of things, it looks relatively smaller, But for a continent to lose such number of people, I don't think is acceptable. But beyond the health consequences, the pandemic has caused even more severe economic consequences on the continent. The other parts of the world have been able to support their economies, support their businesses, but we have not been able to do that. There is no doubt that the key to turning our economies around is bringing the virus under control. And bringing the virus under control means that we must do what others are beginning to do. That is, get access to sufficient vaccines to achieve the herd immunity that the Africa CDC have proposed to us based on their scientific analysis. Can you go to the next slide, please? And understanding is that we require to vaccinate a minimum of 60% of our population if we want to achieve that. And I understand that that 60% assumes a certain high level of efficacy of the vaccines in question. If you have lower efficacy of, say, something below 70%, maybe you should be talking of vaccinating even more people. The Africa CDC has been working very, very hard on this. They've developed a number of initiatives under their strategy for vaccination, essentially making sure that Africans are involved in the clinical development of vaccines, that Africans can access a fair share of those vaccines when they become available, and that we make sure that we remove all the barriers to delivery of the vaccines in an efficient manner. I think based on the work of the Africa CDC, the President of the African Union and President of the Republic of South Africa, His Excellency President Ramaphosa, established the COVID-19 African Vaccine Acquisition Task Team to drive the achievement of the objectives that Africa CDC had outlined. Next slide, please. The role of the AVAT, that is Africa Vaccine Acquisition Task Team, is essentially to support the continent in getting access to vaccines, getting access to the financing that will be required to procure the vaccines. I do not want to go deep into this because I think my brother and friend, Mr. Masiwa, who is leading this effort, will be speaking more about the team. The next slide, please. But it is easy to say that we want to get access to vaccines because unless we have the financing to make sure that happens, it will just be wishful thinking. And let me say something here. It is possible for individual African countries, the 55 African countries we have in this world, in this continent, to start discussions on their own to acquire vaccines. But I'm sure what the experts will tell you that in the context of the way these vaccines are being developed, the speed with which they are being developed, the probability of success of individual vaccines and so on, that it will take more than that to be able to achieve the vaccination of sufficient number of our people to meet the herd immunity that we were talking about. That is why it is important to follow the whole of Africa approach with the Africa CDC proposed and which the African Union is adopting. The estimate we have, that is the Africa Vaccine Acquisition Task Team, the financing required to ensure that we vaccinate 60%. That is about 780 million Africans, is about $9 billion. The chart you have in front of you shows how that will be distributed. The procurement cost at an assumption of about $3.50 per dose for a 2-dose vaccine would amount to about $5.8 billion. The delivery cost, which is slightly about 35%, something slightly higher than that, will be about $3.3 billion. So of the whole cost, delivery cost will be about $3.3 billion. And we have not factored in the delivery cost of, say, a Pfizer vaccine in the form they are being delivered today in the US and Europe. If you add all of these up, it comes to, the total cost will come to about $9.1 billion. The task team have looked at the sources for this. How would Africa get the money to make these procurements? The analysis shows that there are a number of sources that are almost certain, so to say. You have the Gavi COVAX facility, that's the Vaccine Alliance. You have the World Bank, which announced their intervention a few weeks ago, and I believe our brother, Dr. Patti, will be talking about it also. Then you have the self-financing from the countries, because there will still be some expenditures from countries, the countries have to bear, especially with regard to delivery. And then a Flexing Bank. Can you go to the next slide, please? Then following further work on this, we've said to ourselves how, what would be the different contributions of these sources based on the discussions held and the announcements made. We see that COVAX and the donors have available about $1.8 billion that will support lower middle income and also the lower income countries. The about 8, I think, upper middle income and high income countries in Africa will not fall under the advanced market commitments under the COVAX facility. But the COVAX facility will provide support for about 1.8 billion, and I think they'll be talking about it again today to provide more details. Then we estimate that country self-financing will amount to about $500 million. That's $500,000. The World Bank announced a $12 billion support for different countries, but as you know, Africa is just part of the entire world that the World Bank covers. And we're estimating that what will be available may be about $4 billion, or maybe 4 to 5, but they will be speaking more about it today. Then we then think that there will be a residual of anything between 1.8 to 2.8 billion dollars that Africa has to find to be able to meet the $9.1 billion that is required for the vaccines. So Afrexim Bank is stepping in to provide these residual. So that completes the financing, that will complete the financing requirement if everything goes well. And the assumptions that we have made in terms of the pricing, in terms of the logistic cost, in terms of the availability of these finances I've mentioned. If they all work out as we've said, it means that Africa will be covered, and hopefully in the next 12 to 24 months, we'll be achieving the 60% vaccination, the herd immunity we are all looking and hoping for. Let me just go to the next slide, please. Let me say a few words about the COVAX, which I believe my colleagues will be speaking about later today. As I said earlier, they have facilities. They were able to raise more than $2 billion, and they're planning to raise about $5 billion to be able to support the poorer countries of the world. What they've done is that they've entered into commitments, pooling a number of vaccine candidates. What this is helping to achieve is to reduce the risk of failure, because some of these vaccines, they are all being developed. So all these investments will be speculative. So if you put all your eggs in one basket, the vaccine you choose may not really be, may not work, may not be certified, then you lose all the money, or you will not get the vaccine anyway. So what COVAX had done is commit with different vaccine candidates to make it possible for them to be able to access vaccine, whichever one eventually becomes successful. The expectation is that the COVAX facility would be able to support 20% of the population of Africa. And as I said earlier, we are envisaging that about $1.8 billion of the money raised will be used to achieve this 20% vaccination of the continent. But I believe they will be speaking later, and they will be saying more about this. In October, so the next slide, please. I think you have to go next slide also. Next slide. Next slide, please. I've finished with this slide. Okay, thank you. In October, the World Bank Group executive directors approved an envelope of $12 billion, as I said earlier. We expect about $4 to $5 billion maybe available for African countries. That money would help support acquisition of vaccines and also provide technical support to enable the countries to prepare to receive those vaccines and to be able to deliver them to the people. The World Bank also recognizes and supports the COVAX facility arrangements. The World Bank has informed us that they've written to virtually all African governments, providing them information on the availability of the facility and what it can do, and waiting for countries to confirm. I think it will be important for those countries to quickly begin to confirm, so that the World Bank will begin to also know how to allocate their resources. The task team I mentioned has been engaging with the World Bank, and we're coordinating our approach to ensure that the funding comes in time, and also that they're used effectively to achieve the vaccination rate we are planning for. Then, Afrezimag, as I mentioned, as an AU entity, is helping the continent coordinate its response to the COVID-19 pandemic. It is in this regard that, please, can you go to the next slide, please? It is in this context that we've introduced the Africa COVID-19 Vaccine Financing Initiative, which we call ACOFINI for short. The aim of this initiative is to provide up to $5 billion to enable the member countries, the different AU member countries, to procure vaccine in a timely manner, and in a manner that also considers takes account of the severe fiscal burden many of the countries are facing today. It creates a financing structure that assists AU member states who are members of Afreximbank, and there are 51 of them, to be able to access those vaccines in a cost-effective manner. The facility will support the acquisition of vaccines, and more importantly, also support logistics and local manufacture of the vaccines. We're having serious discussions under the auspices of the vaccine acquisition task team and with some manufacturers to see the way we can support manufacture within Africa of some of the vaccine candidates that become successful. Afreximbank is also working with the task team to inform them of the availability of the additional financing from the bank, and also request confirmation of interest. This is important, as I mentioned earlier, regarding the World Bank, so that we can have an idea of what the demand is like, and also begin to put in place the specific approvals that will be required for each of the countries. And to support the vaccine financing arrangement, along with the various other initiatives Afreximbank has put in place to help fight the pandemic, there are ongoing discussions at the African Union on how to strengthen Afreximbank's capitalization. We welcome this initiative because it will make it possible for Afreximbank to be able to scale up should we find shortfalls in any of the sources I mentioned. To achieve the continent's goal of immunizing the 60% of the continent's population within 24 months, it is very important that the continent expands the sources of financing. So we look at donors, we also look internally at within ourselves, different countries, kind of providing funding from their own internal resources, and also Afreximbank and other entities that exist. Afreximbank facility will enable the continent through the task team to go into bilateral discussions with manufacturers, as I mentioned earlier. I think there are discussions ongoing now with Johnson & Johnson, AstraZeneca, Oxford University. All direct deals that will be done under this arrangement will be done under COVAX-supported vaccine manufacturers and under the terms COVAX will have. As I said earlier, whatever we are doing supplements other sources of finance. Can you go to the next slide, please? I think the vaccine financing just goes to complement the other support Afreximbank is providing across the continent.
Wait a minute.
In response to, next slide, please.
Oh,
next slide, please. Next slide. Are you hearing me? Thank you.
Can we help? Thanks.
Yeah, thank you. So since on March 24, Afreximbank announced a facility named the Pandemic Trade Impact Mitigation Facility, which was a rapid response facility intended to support Afreximbank member countries, the AU member countries, to be able to contain the pandemic, to procure the pandemic containment materials, to also enable the countries to adjust in an orderly manner to the pandemic. We also knew that many of the countries were getting support from the multilateral development banks, but the business people, the banks, the commercial banks were not. So this facility was also targeted at making sure that the banks were able to meet their trade debt payments falling due, and that they were able to continue to support SMEs. As I speak to you today, over $6 billion have been disbursed under this facility, and there's just slightly under $2 billion is in the pipeline. We have also put in place a facility together with the UNECA and the Africa CDC, through which we are identifying manufacturers of COVID materials, test kits, PPEs, and so on within Africa, and then providing them the funding to be able to manufacture this. Afreximbank has committed $200 million to this, and as I speak to you, we've disbursed slightly under $80 billion to these SMEs who are producing these items. And we have—
Orama, sorry, are you going to be wrapping up soon?
Okay, that exceeds those.
Thank you.
We've also provided grants, support of the Africa CDC and the COVID Response Fund, and also work with the Africa CDC, Mr. Strive Masiwa, the AU envoy for procurement, to put in place the Africa Medical Supplies Platform, through which we are having now pooled procurement for COVID materials. Afreximbank is doing the payments under that platform and is also providing a $100 million overdraft facility for countries that need overdraft to bridge any short-term funding gap. As I close, let me just restate our commitment to the Africa CDC objective of vaccinating 60% of our population. We support the COVAX strategy of immunizing 20% of the population as soon as an approved vaccine is available. We also are inviting all members who are here to quickly respond to the letters of the World Bank and also the one that will be coming from our Afreximbank, so that we are sure that the financing needed to be able to achieve the objective of Africa CDC is available. Thank you very much for listening.
Thank you so much, Prof. Orama, for such a comprehensive and informative presentation. And there are many questions and comments that have come through. This we will bank for the panel discussion. So it now gives me great pleasure to introduce my co-moderator, who will introduce the next speaker. My co-moderator, like I said earlier, is Dr. Ahmed Ogwell Omar, and he is the Deputy Director of Africa CDC. He is also an accomplished international civil servant and an expert in global health. Ahmed has expertise in how government policy can and should respond to neglected health challenges. Having been a senior servant in Kenya for over a decade, he's well versed in how governments work, competence in supporting government. He also has competence in supporting government to achieve desirable public health goals, particularly in resource-poor settings. So over to you now, Ahmed.
Thank you very much, Professor Dai, and good afternoon, good morning, good evening, colleagues, wherever you may be. And it's a pleasure to introduce the next speaker, Dr. Mohammed Ali Pate, who is currently the Global Director, Health, Nutrition and Population, also Global Practice of the World Bank, and Director of Global Financing Facility for Women, Children, and Adolescents. He's based in Washington, D.C. in the US. Dr. Pate was until recently the Chief Executive Officer of Big Win Philanthropy, based in the UK, and prior to that, held several senior positions, including that of Minister of State for Health in the Federal Republic of Nigeria. He was previously in the World Bank Group, where he joined as a young professional in the year 2000 and worked on health issues in several regions, including Africa and the East Asia and Pacific regions. Dr. Pate has an MD, trained in both internal medicine and infectious diseases, with an MBA from Duke University. Prior to this, he studied at the University College London. He also has a master's in health systems management from the London School of Hygiene and Tropical Medicine in the UK. Mohammed, I would like to welcome you, and just a quick reminder that you have 15 minutes so that you can have enough time for discussion at the end of your presentation. Welcome for your presentation, Mohammed.
Thank you, Ahmed. Excellencies, Honorable Commissioner El-Fadil, distinguished participants, all protocols duly observed. I'm very glad to join you today for this important and timely discussion. While African countries have managed to keep the COVID-19 virus under control with relatively lower number of cases, the pandemic has continued to take a toll on African lives and economies. And even before the outbreak, the outbreak of COVID-19, many low-income countries, and mostly in Africa, were already at risk of debt distress. Recent estimates show that COVID-19 could push up to 40 million people in sub-Saharan Africa into extreme poverty. In the health sector, we know that the pandemic has unleashed a secondary crisis, which we had feared since early part of the pandemic. There have been substantial disruptions in outpatient visits, particularly for children under 5 years of age, childhood vaccinations, family planning services, and care for pregnant women, all of which are key drivers of global progress on key SDGs, including in Africa, in reducing maternal and child mortality. So the World Bank's group response, I would like to take you through that in just a few minutes. As part of the global response, and as my brother, Professor Orama, has already laid out, the World Bank announced that it will be deploying up to 160 billion in financial support over 15 months to help more than 100 countries all over the world, protect the poor and vulnerable people, support businesses, and bolster economic recovery. This included up to $50 billion for IDA countries. In Africa, the World Bank's response is focused around 4 main areas simultaneously: saving lives, protecting the poorest people, protecting and creating jobs, and building back better. Our emergency health response in Africa under the $6 billion Strategic Preparedness and Response Program, which began in March 2020, and is focused on helping countries to strengthen their pandemic response and healthcare systems, is already reaching 35 countries in Africa with a total financing commitment through IDA and IBRD amounting to $885 million. We're also redeploying existing resources in the portfolio of health, urban and resilience projects, including more than 500 million through emergency components in our project restructuring that have been underway. And in addition to support to countries, we are also focused on strengthening coordination and collaboration, supporting regional institutions such as the Africa Center for Disease Control and the West African Health Organization, something that began before the COVID-19 pandemic, including the 250 million project that was approved in December 2019 to strengthen the Africa CDC and the regional collaborating centers in Ethiopia and Zambia. And that project, in fact, now comes with even renewed urgency given what we've seen. So in terms of vaccines, recent weeks, we have seen the fast-moving and hopeful news about a COVID-19 vaccine. But that is only part of the challenge that we have. Deployment and delivery of COVID-19 vaccines to the people who need it is the next frontier. The World Bank is committed to supporting countries in these efforts. Vaccines were anticipated even in the first phase of our global response back in the March-April period under the Strategic Response Program that I referred to. And this past October, our board approved an additional $12 billion to support the purchase and deployment of vaccines together with strengthening of healthcare delivery systems. A total of $18 billion for the health response is within the $150 billion that I mentioned for the overall global response to COVID-19 that the bank announced. It is worth highlighting that the World Bank uses a country-based model to allocate resources following its replenishment of the funds that it uses. And that method takes into account country needs and performance. The pandemic struck during the end of our IDA, that's the International Development Association implementation cycle, which enabled us to access unused funds to provide an exceptional allocation to each country during the initial emergency response this spring. As you know, the IDA 18 finished end of June. Since we are now at the beginning of the IDA 19 cycle, which is the next 3 years, countries will need to prioritize their support to COVID vaccine, for the COVID-19 vaccines through their country envelopes within the framework set for vaccine support. Let me emphasize that this is a demand-driven process and underline the point that Professor Orama repeatedly made. So far in Africa, 13 countries have initiated discussions for vaccine support with project preparation underway in a few of those countries. Cape Verde, Ethiopia, Eswatini, and Republic of Congo already. These countries are prioritizing their readiness efforts so that their health systems will be prepared to successfully deliver the vaccines to their people when the vaccines become available very soon. As part of the planning process and the preparation, we are calling on countries to complete their vaccine readiness assessments. We're working with WHO, UNICEF, Gavi, and the Global Fund to support countries in these efforts, which will help identify critical gaps for ensuring readiness. World Bank financing can then help to finance the readiness gaps that have been identified by them. As we look ahead, it is important that countries in Africa define a strategic approach to rolling out the vaccines. The Africa CDC has an important role to play alongside the Vaccine Acquisition Task Force led by all the colleagues that have been mentioned, including our brother Strive Masiwa, and working with WHO to help translate the global allocation guidance to the African context, particularly with respect to how to identify and target the high-risk populations, taking into account the epidemiology, the geography, the demographics, and perhaps even the socio-economic determinants in each country. The phasing of the rollout beyond the initial target population will also need to be carefully planned in order to reach each country's national vaccination target. The African Union has an important role to play through the envoys on COVID-19, which are already helping the bank and the other financiers, including the Afrexim Bank, to have more strategic and coordinated dialogue with countries on resources needs, and also making the case about the importance of a rapid scale of vaccine preparedness to ensure smooth deployment. In terms of the main theme of this discussion this morning, let me leave you with a few observations and data points outside the discussion of financing to kickstart the discussion that we would have. So first, I think we need to understand deeply the epidemic in each of our countries and in the region, knowing the last 1,000 infections and illnesses and the transmission dynamics, and adjust the allocation criteria that have been provided for globally to the African context. The weightings in Africa will need to be contextualized. Thirdly, Africa has fewer health workers to start with, and far fewer healthcare workers, and has fewer home care residents. Therefore, that also has to be taken into account in the context of the allocation of the vaccines as they become available. Only about 3 to 5% of the region's population are over 65. That's also a factor to consider. Health systems in the region have had less capacity to identify comorbidities such as diabetes, hypertension. For example, the region has the highest proportion of people with undiagnosed diabetes at almost 60%. Comorbidities are also much lower in Africa, with a younger population, lower smoking rates, lower alcoholism rates, and lower prevalence of obesity compared to globally, with notable outliers, which we need to take into account in terms of adapting the global allocation framework in the African context. Now, we also have high proportion of infectious diseases and potential interactions. We need to also prioritize certain other segments, for instance, teachers that we have, so that we can get back our schools open. And again, as we think about allocation of limited vaccine supplies, we need to really understand the epidemic in the context of countries, the dynamics, and also in terms of this region. And I really commend Africa CDC and the Vaccine Acquisition Task Force who really bring in this conversation now, because that's very important given the limited vaccines that will start to be available. There are many questions, for instance, that are linked to that. For instance, given the lower levels of comorbidities and younger population, should the allocation criteria for Africa be more skewed towards socioeconomic determinants than health and demographic ones? Those are questions to ask. For example, we understood in Lesotho, priority groups for the first 20% did not mention as much the elderly or those with comorbidities. The first 3% they are prioritizing are health workers, textile workers, prison workers, etc. And interestingly, the next 17% of the population are the population in Maseru and Leribe, which are the location with the highest number of cases, aged 20 to 44%. That's just to give you an example of how countries will need to contextualize the allocation criteria as we think about deployment of the vaccines. To stop this virus, we cannot do this alone. We need to act together, and I really support the African Union's effort and also Africa EXIM, work of the special envoys and all countries and other partners. The World Bank stands ready to support all countries to make investments that strengthen and facilitate the fair and equitable delivery of vaccines to populations across Africa, especially those who need it most, and with the participation, engagement, and trust of our communities, including religious and community leaders all over the continent, so that the people are at the center of our effort. Thank you very much for the opportunity to share these few thoughts, and I look forward to the discussion with you shortly. Over to you.
Thank you very much, Dr. Pate, and thank you for keeping time. We are aware that you will be leaving us shortly due to competing priorities. So as not to interrupt the flow, what we'll do is we'll collect the questions, we will chase you down and get some answers from you, and then we'll share that with the participants in the course of tomorrow so that we have a good discussion around what you've just presented. I mean, it's really key. We want to benefit from all that 4-5 billion at good rates so that Africa can be well prepared for the whole vaccination chain. So we'll put that package together, share with you, then we can have the conference know what the responses were. Having said that, and thank you very much for keeping time, I would like to now introduce Mr. Strive Masiyiwa, who is currently the AU Special Envoy for COVID-19 response, and also a member of the AU COVID-19 African Vaccine Acquisition Task Team. Indeed, he is leading that team. Strive is founder and executive chairman of South African-based diversified international telecommunication group, Econet Wireless. Under his leadership and guidance, Econet Wireless has developed since its formation in 1993 into a global telecommunication enterprise with a presence in more than 15 countries in Africa, Europe, and the East Asia Pacific region. The company operates in the core areas of mobile cellular telephony, fixed public networks, and internet and satellite services. A recognized entrepreneur, Mr. Masiyiwa has been involved in the development of Africa's independent media. Earlier this year, Strive was appointed Africa Union Special Envoy for COVID-19 response by His Excellency, the President of the Africa Union and also President of South Africa, Cyril Ramaphosa. And he is helping to develop and launch, he helped to develop and launch the African Medical Supplies Platform, a centralized medical supplies procurement platform for African nations. Indeed, now it services even the Caribbean countries. Most recently, he joined the Africa Union's COVID-19 African Vaccine Acquisition Task Team, appointed by the AU chairperson, which is a component in support of the AU's Africa Vaccine Strategy that was endorsed by the Africa Union Bureau of Heads of States and Government on 20th of August in 2020. Strive, for the next 15 minutes, please share with us your thoughts around how to acquire enough doses of COVID-19 vaccines for the African continent. Strive, you have the floor. Strive, you're muted. If you could unmute. If the technical team can check with Strive what difficulties there may be in as far as unmuting and contributing is concerned.
the person is on the panelist side.
Maybe
he
as
needs to be unmuted.
we wait for Strive's connection to come back on board. Mohammed, if you're still there, there's a quick question here for you before you leave. And the question is that your presentation was quite critical to sustaining Africa's economic rebound. How will the initiative that the World Bank has put in place be deployed to create output growth in local manufacturing? How do you see those grants that the loans that you're going to be providing to African nations being able to support output in local manufacturing? Mohammed?
Thank you. So in terms of the financing that is available to countries, essentially they can finance products that are manufactured locally as well as internationally in terms of the procurement of goods that are needed as they become available. On the other hand, the bank has also, through its IFC, the private sector window, established a global health platform that has put together resources for manufacturers across the value chain, whether it's for PPE, for medical equipment, or even vaccine manufacturing capacity improvement. That's through the private sector window of the World Bank. At the end of the day, it depends on really the demand. The resources have been put on the table, basically, and the case will then need to be met by both countries on one hand, but also on the other hand, through the IFC by the private sector participants.
Thank you very much, Mohammed. Very clear there. A quick follow-up question is how the bank is engaging with particularly the countries in Africa to have them take up this opportunity since time is of the essence. How is the bank engaging with African countries that are eligible?
Yes, I think Professor Orama mentioned, I also emphasize that we wrote to all the African countries together with WHO, UNICEF, Gavi, and Global Fund, a single letter asking them to appoint a high-level official to coordinate one national plan and to work with us in terms of assessing the readiness of those countries, whether it's the cold chain infrastructure they need, the logistical infrastructure, the human resources, and whatever financing they need. And then we work together to fill those. The engagement with the African Union, the Africa CDC, and the special envoys on COVID-19 in the Africa region is part of that effort so that we have a coherent approach to engaging with countries. And it's very important that we do so that at the end of the day, I don't think there's one institution that has enough resources to be able to provide all that Africa needs. But working together, I hope we can be able to bring the strength of our various institutions to support countries. At the end of the day, countries will have to make those choices and countries will need to implement. So we're working closely with various partners, both globally, regionally, but also at the country level.
Thank you very much, Mohammed, for that. And we will do our part as Africa CDC, Africa Union, to encourage countries to take up that opportunity. And though they are here, they are hearing, and we hope that they can be able to respond in good time. Is Strive managed to connect for his presentation?
I see a note that says all Google services are down worldwide. So I think that may be an issue.
Right, right. Amis, maybe we can be able to collect the questions for Professor Rama and Mohammed, and we then try and link back to Strive when the connection is better.
Yeah, Strive will be joining in about 2 minutes. I think I just spoke with him.
Very well. Then we can take one more question for Mohammed before he leaves, as we wait for Strive to join. One more question for Strive, for Mohammed, please. Mohammed, maybe before we invite Strive to speak, the last question for you before you leave is there's this range that is there of 4 to 5 billion. How do you see Africa's capacity? Can they be able to absorb all the 4-5 billion that the bank has set aside, looking at the engagement that you already have with the African countries?
I think time will tell. The resources have been made available, at least from the bank's board, both for IDA and IBRD countries. And I think it's important that countries look inwards, look at their needs, and look at the target population that the African Union has agreed, and see where is the financing going to come. And it may be a combination of sources, including the bank, including other sources. At least on the bank side, we put those resources on the table for countries to make a choice. We'll not be making those choices for countries. It's also not only for the procurement of vaccines, but also on the delivery side, including logistics and supporting them to be able to do that. This is for the health response. Even broader than that, the resources are available if countries would like to use those resources.
And finally, the elephant in the room called Africa. How will the bank ensure that the funds end up being used specifically for vaccine acquisition and delivery, and not to other alternative efforts?
Yes, no, the very important point, and I think that's sort of keeping us quite awake at night. We've seen such issues not only in Africa, but all over the world. These issues are not limited to Africa. We've seen them in other parts of the world as well. It's important that the policies for allocation, for instance, are made inclusively and transparently. It's important that civil society organizations be not only advocates, but also keep an eye on the accountability side to ensure that there is proper tracking. So the systems are placed to monitor who gets what, but also to ensure there is no leakage, no filtrage, and no, and that, including the media, basically, making sure that there is close monitoring. These are public resources, and that we should ensure they are used for the intended purposes. So it's important that all of us be advocates on that, to include civil society in the conversations at the country level, not just at the global level.
Now, thank you very much, Mohammed, for agreeing for us to stretch you a bit before you go. We'll buy you coffee next time we meet when the pandemic is down. Thanks a lot.
Thank you, Ahmed.
Thanks a lot. I see now Strive has connected. Strive, we were waiting for your wisdom. And now that the connection has agreed, if you could take the floor 15 minutes and share with us your thoughts on the issue of vaccine acquisition for Africa. Strive? Strive, you're muted. We can see you, but we can't hear you. Strive, can you hear us? You seem to be muted. Voila, now you can speak.
Good afternoon, how are you?
Very well and welcome.
Can you hear me? I'm sorry, we seem to have had an absolute mix-up in the scheduling here. Good. What would you like me to talk about?
Strive, today we would like you to share with us your wisdom in as far as the COVID-19 vaccine acquisition task team is concerned, and what that team is doing to ensure that Africa gets adequate doses of vaccines for use on the continent, as per the figures being given by Africa CDC of 60% vaccination.
Okay, so how many minutes do I have?
You have 15 minutes, sir.
Thank you so much. Good to see you all. As you know, in August this year, President Ramaphosa and the Bureau of Presidents summoned a meeting to discuss Africa's vaccine strategy. And the meeting was attended by about 10 heads of state, chaired by President Ramaphosa, and the 7 special envoys that are helping him with this crisis. The Africa CDC presented a very compelling argument on herd immunity, if I've got the right term, through vaccination. My recollection of that discussion was John Kengasong made it clear to the heads of state that if we are to stop Africa becoming the permanent home of COVID-19, we have to pursue a strategy whereby we vaccinate at least 60% of our people. In that we shouldn't just be pursuing emergency supplies. The heads of state endorsed that strategy and then assigned the special envoys to help John and the Africa CDC come back with a plan of how it could be done. So the envoys, such as myself, Donald Kaberuka, and many others, sat down with John to examine what this meant from a financing point of view. And we subsequently went back to the heads of state through President Ramaphosa. And we presented to them a financing plan based on our understanding from the discussions that had been held with various parties, not least the Gavi COVAX initiative, as well as other bilateral countries that have made offers to Africa to acquire vaccines. To put it short, our plan had the understanding that to achieve the 60%, so far we can only see about 20% of that being commitments from international donors through COVAX. We therefore have a major shortfall of 40% of the financing. So even if we took up the COVAX as it stands, we would only be vaccinating up to about 20% of our population. Unless, of course, subsequently donors come up with more money and support the acquisition. This has, therefore, as a matter of prudence, President Ramaphosa then convened us and set up a new group that reports directly to him that is called the Africa Vaccine Acquisition Task Team, AVAT or AVAT, depending on which side of the Atlantic you get your pronunciations. So AVAT is about 10 people. We meet several times a week at the moment. It now includes health ministers, including the Minister of Health of South Africa. And some of the special envoys, John Kengasong, as well as the president of the Afri-Exim-Bank. And so we've mapped the funding situation, having also met with the World Bank team, We're very grateful to Dr. Muhammad Pate, who has really emerged as a champion. And I know he spoke before me. And we have a working group now between the AVAT team and the World Bank. We've essentially been discussing the World Bank funding. And so we hope that the African countries will access at least 4 billion. We need them to access at least 4 billion of the World Bank funding as part of the vaccine financing. We would still have a shortfall of about 3 billion. So if you summarize the way we see the funding, based on the studies done by the Africa CDC and their advisors, the total cost of the vaccine and its delivery all the way to the arms of 750 million Africans within 2 years would cost us just over $9 billion US. So we would have a shortfall of just under 3 billion if we draw down the COVAX facility, if we draw down the World Bank facility. So Afri-Exim Bank, which as you all know is owned by the African countries, has put into place a facility for an additional 3 billion. So that basically means we can fund 60%. Okay, we can fund it through the donors. We also anticipate that the African countries themselves would fund at least 15%. So that would bring us to our total of just over $9.03 billion or something like that, would be what we anticipate is the cost of this. So the next question is, where do we get the vaccines? If the money is there, and member states can actually draw down almost immediately to purchase vaccines over and above the vaccines we expect them to get from COVAX, where would these vaccines come from? That has necessitated us, under the instruction of President Ramaphosa, to directly engage the suppliers. And we are engaging the suppliers that are part of COVAX, those suppliers only that are in COVAX. We are not engaging suppliers who are not amongst the selected vaccines that COVAX is pursuing. So we have met with most of them, and we've had very constructive discussions with most of them. You don't need me to tell you how difficult it is right now. And it has intensified since the Pfizer situation and the rollouts in beginning in Europe. But really, all we want to do is to make sure that within this first quarter, Africa begins to get vaccines. My own role with my colleagues is not about lobbying anybody. What we are saying is, if there are vaccines available, we are willing to buy, and on behalf of the African countries, because that's what everybody else is doing, okay? So we're willing to buy. And member states that are here and now are free to contact us directly, although we are beginning a roadshow this week where we will be explaining to the members of states in greater detail the financing plans and the willingness to support them in exactly the same way we did with testing and test kits and PPE and so forth. So I'll stop there, Ahmed, for now, and I'm ready to take any questions.
Thank you very much, Strive. Very illuminating there, and some questions are already coming in, which we'll ask you. But now I'd like to cede the floor to my co-moderator, Amis, to be able to ask a few questions to Professor Orama. Then we'll come back to you, Strive. Amis, you and I?
Yeah, I'm on. Thank you. Thank you so much, Ahmed. And thank you, Strive, for this very informative presentation. I think we've now come to our panel discussion part of the program. And Strive, I'm going to give you some time to just catch your breath and relax. And I'm going to go for Prof. Orama. Prof. Orama, are you ready?
Yes.
Okay. So there's a question that's come through that asks, in terms of the credit line provided by Afreximbank, will countries securing doses through the AU platform have to provide sovereign guarantees? If this is the case, are we not concerned that many countries will not be in a position to secure doses? And as a result, the AU may secure doses but not secure sufficient uptake?
No, thank you very much. That's a very good question. The issue of COVID is life and death if we don't know it. It's only a country that is able to stand up on its feet in the next 3, 4, 5 years that will be able to pursue the opportunities before it. And countries would perhaps not be able to stand up in 3, 4 years unless they rein in COVID-19. So having access to the vaccine is critical. It should be a priority for our countries because you cannot talk about economic recovery unless you bring the vaccine, bring the pandemic under control. Having said that, the funding we are providing will go to the government. So it's not direct, it's not a matter of sovereign guarantee. It will go to the governments or agencies of the government. The governments individually can find ways to reduce the fiscal impact of the acquisition. But the arrangement being made is that the acquisitions will have to go through the government because some governments would like to provide the vaccines free of charge. Some may want to provide aspects of it free of charge, while they will charge for a percentage to people who can afford it. But that is, in my view, will be the policy of the different government, however they want to manage it, and depending on their fiscal conditions and their priorities. But just to repeat, the facilities will be provided, will be going to the government. The facilities will be provided bearing in mind, that is in terms of the pricing and the terms and conditions. It will bear in mind the fiscal situation our countries are in so that they will have the best of terms to be able to carry it and be able to recover and be in a position to repay the facility when they become due. Thank you.
Thank you. Thank you so much, Prof, for responding to that question. I have a question for Strive. We have a funding agency, and Solomon Melky has asked this question. We have a funding agency. Do we have a specified time to start the vaccination in Africa? There's concerns that the approval of the Pfizer vaccine to younger people of 16 years old and other vaccines to younger people in other countries will lead to very limited doses available for Africa. The concern is that there may be too much of a delay in getting the vaccines into Africa. And because we have had clinical trials in Africa, should we not also be getting the vaccines at the same time? Your take on that, Strive?
The question is not clear to me, okay? So let me just maybe answer it the best way I understand it. So first and foremost, the AVAT team includes Africa CDC. The Africa CDC has a group of people who are experts in the vaccines. I know nothing about vaccines, okay? I'm just a businessman who's part of the group looking at how do we fund what they want and how do we negotiate with the would-be suppliers. So yes, we've met with Pfizer, and there are some member states who have indicated their ability to take the Pfizer vaccine, okay? And so to the extent that we secure Pfizer vaccines, those countries will draw down Pfizer. We've met with Johnson & Johnson, and we've met with AstraZeneca. So we know the various vaccine groups and the timelines within which those vaccines would become available. For example, Johnson & Johnson, although it comes later than Pfizer, it could be as early as February or so, we anticipate seeing the Johnson & Johnson vaccine. Whether or not we get it at that time in Africa is something we are obviously going to fight hard. But the Johnson & Johnson vaccine will also be produced in Durban, South Africa at the end of the year. And they'll be producing 300 million doses. And it's a single dose vaccine, which means 300 million, that is almost 40% of our target population of 750 million people. So the big challenge is those early months, kind of between now and June, getting sufficient supplies in. Remember, we are not replacing the COVAX structure. We are parallel and we're extremely supportive to the COVAX structure, but we have a sovereign responsibility to our own people that we're out there trying to do something, okay? So to the extent that we can secure some over and above COVAX, I don't know anything about COVAX timelines or when they might expect to see some shipments, but we will work hand in hand with them.
Thank you so much, Strive. And just a further question. And Jabulani Nyenwa asks this: in your engagements with the suppliers, what is the appetite for special pricing for LMICs? And what are the prospects for accelerated depatenting to enhance prospects of local production? Over.
You know, if you go to someone who has something that is in extreme short supply, I want to be very honest here. These vaccines are in extreme short supply. Right there in front of these suppliers is Indonesia trying to buy vaccines. Brazil is trying to buy vaccines. Think of every major nation of the world is up trying to buy vaccines, okay? If we can get those vaccines at the same price as what they are charging COVAX, okay, we consider that a win, okay? What is important right now is to get access, and we are not there yet. Okay, we are just not there yet. So I want to be clear there that I'm not in a discussion about patents and so forth. Those conversations will come later. I think it's a big win that there will be production of one of the key vaccines in South Africa at the end of the year. Okay, but we're not yet at a place where we can begin to talk beyond that. Okay, there are countries who have stepped forward. Okay, China, for example, have stepped forward and offered to manufacture further from within the African continent. I don't want to talk about that because quite a lot of that is bilateral with certain countries, okay? And I'm not privy or authorized to speak beyond that, okay? But what I can say at the moment is, okay, my colleagues and I are in a big battle, okay, to secure something in a race with other suppliers and with the disease, which is taking lives. Okay, so that's where I will stop.
Thank you so much, and really appreciate your responses, in fact, to both our panelists that are remaining with us. I'm going to ask Ahmed to come over, to take over, and just to wrap up the session, because we're almost into our next session. Ahmed, over to you.
Thank you very much, Ames, and for the panelists, including Mohammed, who's left, a very big gratitude. But before we let them go, two quick questions for you, Strive. One is, which suppliers, if at all, have been approved for the COVAX facility? And secondly, now that the AVAT team is driving a continental agenda, will that team be engaging with individual member states so that they don't go into bilateral arrangements, but utilize the continental platform that you and your colleagues are currently driving? So two quick questions before we...
I'll answer the second part of your question. Countries are sovereign in Africa. They can go their way and they can do whatever. And you know, some have already announced that they've done bilateral deals. Morocco has done a bilateral deal. There's a couple of countries who are in a similar situation. But it's a little bit for Africa, we are in the same position we were with test kits. If you recall, at the beginning of this crisis, we were managing only to secure 40,000 test kits per country per month, okay? When we were looking for 15 million. And everybody was running around trying to do their own thing and ended up paying $50 for a PCR test kit. We're trying to help deal with that problem with an equally high demand product. So that's one. The second thing is obviously the issue of efficacy. Okay, I defer to Dr. John Kengasong and his guys. Okay, you guys know what is in the COVAX list of vaccines that they have, that they are pursuing. Okay, and I'm sure that list can be released appropriately. But every supplier we are talking to can only be within that group. And we would not recommend acquisition of a vaccine which has not been approved by WHO and is part of a contract with COVAX. All we are simply saying is, if there's a supplier who's supplying, say, 500 million doses to COVAX, but has another 200 million doses available, Africa wants that 200 million, because we're trying to build up to our 40%, our additional 40%, okay? So efficacy, number one, we won't touch a vaccine if they cannot confirm that they have an existing contract and are suppliers to the COVAX pool.
Very clear, Strive, and thank you very much for those insights. Now, a very big thank you to Professor Benedict Orama, Dr. Muhammad Ali Pate, and Mr. Strive Masiyiwa for being panelists during this session 2 of this conference. It is very clear that Africa has an opportunity to be able to work as a group to access decent amounts of COVID vaccines that will have been cleared for use in terms of efficacy and safety. There are opportunities for funding apart from what a country will come up with domestically. Afrexim Bank has a facility, the World Bank has a facility, and of course, COVAX is providing a facility for the low, middle income and low income countries, particularly those in Africa. So we are very hopeful that within the first 2 quarters of next year, we will be seeing these vaccines on the continent. Thank you very much again to the panelists. Ames, if you can close
before you go, let me also, I know there are colleagues on the call for whom I need to also point out something. We are aware, of course, and it has been heavily in the media, that there are countries who took a position to secure supplies of different vaccines because they did not know which ones would work. As we increasingly know which ones work, we want those countries who have additional supplies to know that we are ready to buy if they release them to us on the same terms and conditions. Okay, so if you're listening to me out there, EU, Britain, Canada, and so forth, and we're not going to come and hit you on the head to say, why did you buy so much? But we really feel, now that you know we have some money, you saw Dr. Pate there, you saw Professor Orama there, okay? Would we love you to put more money into COVAX as a donation? Absolutely. But if you want to sell what you have, what you've secured, that you believe over the next 6 weeks you will no longer need, call us. Thank you.
Thank you so much, Strive, for this impassioned plea, and I do hope that the members, the countries out there, hear you and respond to you. And on that note, I'm going to hand over to Prof. Stanley Okolo to start the next session. Thank you to all our panelists and my co-moderator. Stanley.
Thank you very much, Professor Dai, and thank you, previous panelists. It was extremely educative to listen. And I thank you also, as you said, Professor Masiyiwa, Strive, for the passion and for the direction in terms of how we are possibly going to have vaccines for Africa. The next session is a special session that is going to look at COVID-19 vaccines and economic investment case of Africa. And what I would do in introducing this session, obviously, it would be to introduce our panelists, but I would rather introduce them at the time that I will be calling on them to speak. We have 4 panelists, and we have Dr. Vera Songwe, who is the United Nations Under-Secretary General and the Executive Secretary, United Nations Economic Commission for Africa. We have Dr. Mohamed Ibrahim, an economist, technical office of the Vice Minister of Finance for Public Treasury. We also have the finance ministers of 5 of our countries who are also part of the panel for this particular discussion. And then we have, in addition to those that I have already mentioned, we have Dr. Ngozi Okonjo-Iweala from Nigeria. I will introduce Dr. Iweala fully when I call on her to speak. Mr. Trevor McDonald and Dr. Donald Kaberuka. We know that the Africa CDC and the Africa Union have the platform and the strategy for getting vaccines. And to achieve this, there are three key objectives. One was to accelerate African involvement in the clinical development of a vaccine, and we've just heard from the previous panel about the Johnson & Johnson vaccine, for which an African country, South Africa, is partnering in the production of that vaccine. There is, of course, the second strategy or key objective, which is to ensure that African countries can access a sufficient share of the global vaccine supply. We think that this may be what we require, maybe up to 1.5 billion, but we have heard that at least we may be able to get up to 300 million through the Johnson & Johnson protocol. And then finally, the third objective is how to remove barriers to widespread delivery and uptake of effective vaccines across Africa. So for us on this panel, what we are going to be looking at is how do we make that economic investment case for Africa, so that people will now look at the issue of vaccines in Africa being another tool in us not only limiting transmission, preventing death, but also limiting harm due to this pandemic. It gives me great pleasure, therefore, to first of all call on Dr. Vera Songwe, who is the Economic Executive Secretary of the Economic Commission for Africa. And I would introduce Dr. Songwe, who is an economist and is also the United Nations Under Secretary General for Economic Commission in Africa. Please bear with me for 1 minute because my Vera was recently listed as one of Africa's 50 most powerful women by Forbes, and she's also named as one of the 100 most influential Africans by Jeune Afrique in 2019. She's acknowledged for her long-standing track record of providing policy advice and her wealth of experience in delivering development results for Africa. Prior to the ECA, she held a number of senior leadership roles with the International Finance Corporation and the World Bank. Dr. Songwe, may I please invite you to make your contribution on this panel? Thank you. Dr. Songwe, are you with us?
Professor Okolo, I think if she's not responding, I'll suggest that we move on, and then I'm sure that since it seems like we are running a little bit winning some time, maybe she will come in later, and then we'll let you know. So I would suggest, if it's possible, to move on with the next.
All right. In which case, John, I think I may have to call on you then to sort of be our first speaker. Maybe you wish to say a few things about the strategy. And if you could, possibly, whilst we wait for Vera, because I think we are supposed to start at 2:25, actually. So we're a little bit ahead of time, but John, over to you.
Thank you, Stanley, and good to see you. I think let me articulate my comments around what has been said already, and I just really like to acknowledge what Strive Masiwa has said. I mean, he's truly a vaccine champion for our continent. And I usually, in our deliberations, as part of the ADVAC, I always refer to him as our COVID vaccine warrior. Because if he says he's not a vaccine expert, but I'm sure you've heard from his remarks clearly that he knows the ins and outs of these vaccines and what is at stake. But let me just, if you permit, frame my reflections in 3 dimensions. One is that we truly need a whole of Africa approach. And I'll come back to that shortly. And second is that we have to really, the time to prepare for these vaccines was yesterday. That is the delivery of the vaccines was yesterday. I think that is very, very important. And lastly, that we should, it will be a message directed to the global community as a whole, that the moment we have been talking about global cooperation and solidarity is now, that the time for warm words and statements of principles was yesterday. So I think that is what I would like to reflect on. So let me start with the whole of Africa approach. Several speakers have alluded to the fact that we truly need to go into this as one. We should always remember, and I would never stop talking about this because, I mean, our people of our generation were part of this fight. In the mid-1996, where antiretroviral therapy was available, made available. I remember in a meeting in Vancouver, the AIDS meeting in Vancouver, and we're all very excited. At that time, it costed $10,000 per treatment per patient over a course of 12 months or 1 year. And if you look at the mortality curve that ensued at that time for countries that started administering ARV drugs, the antiretroviral treatment, that is treatment for HIV/AIDS, it decreased dramatically. But our continent, it would take us almost 10 years between 1996 and 2006, thanks to the efforts like the Global Fund or the US President's emergency plans for AIDS relief, before we started truly seeing the bending of our curve on the continent, where mortality started decreasing. And that it would take 10 years. And between that time, that is between 96 and 2006, about 12 million Africans died. I call that a moral crisis and a moral disaster, which should never happen. And we can only avert that if we truly approach this using the whole of the continent approach, which says that we have to use and harness all the assets that we have to work collaboratively, hand in hand with one voice, to approach the critical issues of vaccines. We will be in this struggle for many, many months and years to come to get rid of this terrible virus. So I'm very pleased that we are seeing these partnerships emerging between the private sector, special envoys who are economists, people like Dr. Songwe, that we spent long evenings with Donald Kaburuka and Professor Orama. I think I've spent more time with the non-public health experts than I've spent time with the public health experts. I think, and the strong leadership that the chairperson of the African Union Commission, Chairperson Musa Faki, and of course, the president of the union, President Cyril Ramaphosa, have exercised. I think tremendous leadership that speaks to the need for us to have the whole of Africa approach. It is through this whole of Africa approach that we are going to also use the whole of society approach to deploy vaccines. This is not longer in the realm strictly of public health. This is, has transcended public health, and it is a survival issue for our continent, a survival for our economy, survival for our development, and survival for humanity in Africa. So I think that is extremely important. I remember, just going back again to the HIV analogy, in Durban, during the AIDS conference in Durban in 2002 with our much beloved Madiba, all advocating for access to antiretroviral therapy. I think that reminds us again very strongly that we should never allow such a moral disaster and a moral crisis to characterize the world. The history of this pandemic will be written for sure. And when the history is written, we want to be on the right side of history. We want to be on the right side of history with respect to timely and fair access to vaccines to our people. And the people that will read that history need to know, they'll ask the fundamental question as to where we were at this point, at this turning point on the continent, when the continent was challenged. I've always said that perhaps this crisis is the one of a century, probably the crisis that is only likened to the fight for our independence, where our forefathers fought for the independence of the continent. And I think this is our own generation, our own time, and we have to do what it takes to work as the whole of the continent, the whole of society, to bring vaccines to our people. The second thing then is a segue to our own individual responsibility, the collectivity of now and the urgency of now, which says that we have to be creative. The continent and the world has never vaccinated more than 200 million people in a year. And I repeat, the world has never vaccinated more than 500 million of people in a year. And Africa has never vaccinated more than 100 million or 200 million people in a year, especially given the context we are dealing with here, which means there will be multiple and competing needs for vaccines. We know our EPI program, that is the expanded program on immunization, are good at vaccinating people, that are young children, and of course, this is very different from that. So I think we have to put systems in place and build the partnerships and think outside of the box. For example, the regulatory issues that, are we going to approach these vaccines from saying each country look at a vaccine and then put together its regulatory mechanism to approve that? Or are we going to believe in ourselves and use the power that we have, the capacity and capabilities that we have on the continent, of all the instruments that we have, for example, the AVAREV, the AU NEPAD system, the African Union, the muscles of the African Union, to put together a task force that will allow us and enable us to rally around a product that will be valid across the continent if we have that stamp of approval is provided. Those are some of the fundamental elements that we need to begin to address and address urgently. We need to look at partnerships, innovative partnerships, and say, well, if Coca-Cola is delivered in a remote part of any country, remote part of my native Cameroon, can we develop such partnerships that will enable us to take these vaccines to the most remote area of the countries? And using, of course, the epidemiology, as Mohamed Pate very brilliantly outlined, we need to know a pandemic. And knowing a pandemic before the vaccine distribution means we know who is the most deserving. We also need to know how the pandemic is moving, and we have to understand with specificity as to why are we vaccinating. It's not a question of whether you're doing 20% or 40%. It is a question of what is the purpose of the vaccination. Is it to avert mortality or to avert prevention or transmission there? It has to be very clear, and I'm pleased that it's well captured in our strategy. Just last week, the Lancet published a commentary or an editorial that speaks to the fact that Africa would not survive with 20%, that we need 60%. It is in the Lancet, and I urge everyone on this very important forum to read that editorial very carefully. And I think they all speak to the different elements and tools that are important for us to get there. And lastly, and I see that Dr. Songwe is on, I would like to shorten my comments and yield the rest of my time to her. I know she's pressed with time. I will just speak to the global solidarity and cooperation that I alluded to earlier. What does that mean? I think before, when this crisis started, we all were in total shock, and we are still in total shock with respect to the size and scale and speed of the pandemic. We've also are very pleased with the advances that science has made. It is also the first time in the history of infectious diseases where we know a new virus, understand the sequences within 2 weeks, and within less than 12 months, we can produce an effective vaccine, a vaccine that goes through phase 1, phase 2, and phase 3 trials. And these vaccines are extremely safe and extremely effective for those that we have seen so far. The question now becomes, how do we translate that call for solidarity, call for cooperation, and call for unity, the unity of purpose that we've always expressed all along since January. We knew this day was going to come, and we have to move from expressing statements of principles and goodwill and warm words and saying the right thing to action. Now, our people, the people of Africa, will not be watching vaccination on the screens occurring in Europe and the United States, and we are sitting here without appropriate answers to their needs, appropriate answers as with respect to when and how they will get the vaccines. So I think that is what the spirit of true solidarity, cooperation, and unity of purpose prevails. Thank you, Stanley, for the opportunity to share my reflections.
Thank you, John. And as always, excellent in terms of grasping the Africa whole approach. You talked about 3 issues. And of course, you started off by saying this is a question of morality. You talked about the Africa whole approach. You talked about partnerships for delivery so that, you know, if we look at it as a global operation, Coca-Cola gets to the remotest parts of Africa. Why can't we get the vaccines to the remotest part of Africa? And then you talked about the global solidarity and cooperation and how we have to make sure that we now stop talking about it and having platitudes, but actually seeing it in practice. Thank you, John, for filling up the gaps. And John, one question for you before you go, because some of our speakers are going to be pressed for time, I will not leave the questions till the end. I will be asking questions to speakers as they speak. Vera has joined us now, but she's only going to be around for about 30 minutes. So after her own contribution, I'll also pose some questions to her. But for you, John, how are we going to approach the issue of authorization, in other words, registration of vaccines, and also the issue of question of liability? What are the thoughts about how we'll approach that in Africa?
We thank you, Stanley, for those 2 key important questions. I think the question of regulation and authorization is what I alluded to earlier, that it is through the whole of the Africa approach that we say we trust our institutions and we use some of our national authorities to a centralized mechanism that will enable us to move forward. We've seen this in the area of diagnostics and others, where country by country, they want to do their own things and get the approval for the same thing that is happening in next door, say next door at Benin or next door at Ghana, whereas there's actually no principle behind it as to say, well, if a vaccine is approved by a regulatory body in Europe, the United States, and then the experts on the continent all come together and review that and say, look, the vaccine truly is safe, the vaccine is efficacious. We are looking at this as experts on the continent and giving a stamp of approval. There's absolutely no reason, and should be, given the circumstances, this unprecedented circumstances for a country X not to use that kind of guidance. I think that is the only way we are going to accelerate this and move it to the right population. With respect to your second question, I really think this is the opportunity for us to discuss it during these 2 days and come out with a consensus on what we think it should be with respect to indemnification for the vaccines and the related vaccination that will accompany it. So thank you, Stanley, and over to you.
Thank you very much, John. And I will swiftly move on to Dr. Songwe. Vera had actually introduced you in your absence. So no pressure whatsoever, but I have introduced you fully in terms of the recent events and, of course, your previous work with IFC and the World Bank. But being named one of the 50 most influential women by Forbes magazine is really that we are all very keen to listen to your contribution. Thank you for joining us, and apologies that we started slightly earlier than advertised. Over to you, Vera.
I was filling in for you, Dr. Songwe, and I felt very short. So I'm sure the audience is very pleased to have you and get me out of their way. So thank you.
No. I'm only doing this for Dr. Kengasong. I think he is our pride on the continent. I think if we didn't have somebody like him on the continent, we would be in a lot of trouble. He works tirelessly through the weekend, still last night we were still talking. And I think that that is probably the first message of this crisis, is that it is a crisis where Africans, in our capacities, in our experience, our specializations, have been able to excel. And I think that is the first part of this crisis, and we must acknowledge that, and acknowledge, I think, the amazing work that CDC is doing. Yesterday, I think we were listening to CDC United States that had not yet endorsed the vaccine at that hour of the evening, even though it was leaving the warehouses of Michigan to go out into the rest of the United States. And that is the job that John does for us on the continent. He endorses what we do. He tells us whether we should take medicines and what PPEs we should do. And I think one of the reasons why Africa didn't suffer from a lot of the PPE shortages that we saw across the globe was because he was heading CDC and was able to work with the envoys to ensure that we got PPEs in time to the citizens, and to continue the cry for testing and ensuring that Africa was meeting its target. So thank you, John. And so I'm here for you. But I come from a different perspective. I come from the economics perspective. I come from the perspective that says, how do we pay for these vaccines? Yes, it's all good and great, testing, vaccinating 60% of our population. And we do know that the vaccination for our economies is going to be, getting that vaccine coming into our economies and ensuring that we're better. And before I continue, I just wanted to stop actually and say, yesterday we received this really, really terrible news, which was the passing of the Prime Minister of Eswatini from COVID. So it is still attacking us. It is still, our numbers are high, our leaders, our people, it is in our communities. It is maybe not affecting us as much as we will think. And I leave this to John and the next part of this conversation. But actually, and I was talking with John about this, it's once you've gotten COVID, there is a lot of sort of, secondary symptoms that we carry along, which mean that we have to finance different sicknesses in our economy. So the economic impact of COVID is going to last and stay with us for a long time, even if we appear to be a resilient economy. Now, Africa was not doing so well before we got into the crisis. Many of our countries were, not growing at the levels at which we need to grow. We need to grow at 10% on this continent, across the continent on average, to be able to create the 13 million jobs that are needed for us to be able to get to 2030, the Agenda 2030, which is on the way to Agenda 2063, of course, creating a more prosperous Africa, an Africa that has less poor people. Today, Africa is the continent that has the unique privilege to have most of the poor people in the world, starting with Nigeria. But we had started the decade on the assumption that we could do better in this decade. Of course, we have had COVID. Africa is suffering its first recession in 25 years. So the impacts of this crisis are hard. They are felt across the continent. We don't even know all of it because 70% of our economy is informal. So it's very difficult to catch and get all the statistics about the informal economies. But the Economic Commission for Africa, we have run a survey that showed us in Kenya, and now we're running one in Uganda, that says that the small and medium enterprise businesses, which are 80% again of our formal sector, are the ones that are the hardest hit. So when we start talking about the vaccine and how are we going to get the vaccine and what do we need to do to get the vaccine, I think it's very important to see the vaccine not only as, yes, we're getting the vaccine to help us get out of COVID, but we're actually getting the vaccine because that is the first way we restart our economies. That's the first way we manage to ensure that we can actually do the things we want to do. We just had our leaders agree that we would launch the African Continental Free Trade Area Agreement January 1. The African Continental Free Trade Area Agreement asked for us to trade across borders. It asked for us to walk across borders. But we know that one of the ways in which, particularly in the East African corridor, where COVID has been spread very fast, has been through truck drivers, doing their jobs, carrying commodities up and down the East African corridor. So for those kinds of activities to continue, for small business women to be able to have their livelihoods and their lives sustained, they will need to do that. And that's why we need the vaccine. Now, I think John has been very, very right in saying that we cannot get 20% of the vaccine. It will not be enough for our economies. We need to start looking at how we get 60% of the vaccine. Three things are going to be needed for that. One is leadership. We're going to need an absolute focus of our leadership to ensure that not only are we getting the vaccine at 60% of our populations, but also that we're getting it on time. If we get 60% of the vaccine in January 2022, I don't know, what the purpose of that will be at that point. We need to make sure that inside of 2021, at least some part of our populations begin to get the vaccine coming to them. And that's where leadership, that's where the leadership of the CDC, the leadership of the African Union President, leadership of Gavi and all of our colleagues on the continent that are at the forefront of this crisis becomes important. The second one is, of course, financing. We can have leadership, but if we don't have financing, we cannot access the vaccine. And I think an important conversation around that is, how do we do the financing? That's where at the Economic Commission for Africa, our humble position on this is, how can we contribute to the financing conversation? We have, of course, the COVAX facility that has already stood up, to finance some of the vaccines for some part of our economies, but only 20%. And then we have the World Bank that has also announced some financing, but there are still some gaps. So what we are working to do is to see whether, institutions like the Afri-Exim Bank, can we leverage their balance sheet to see that they can close up those gaps? Can we look at, some of the pension funds on the continent to ensure that we can close up those gaps? So we are working on developing and designing models. If we are successful, this will be the first time where Africa comes together, and I think John was talking about this, as a continent, and says we're taking collective leadership to make sure that all of us collectively get the vaccine together. It is going to be particularly important that we don't let ourselves be splintered. I think the benefit of the COVAX facility and CPE is that they have 9 vaccines that they're looking at, and I speak, of course, under the control of all of you doctors here. And so, it gives us a little bit of pooling. So we pool our risk by saying, at least we have resources to buy any one of these 9 vaccines. It could be, of course, there's a cost component to it. AstraZeneca vaccine is slightly cheaper. The effectiveness rate, I think everybody was saying if we get 50%, we should be great there at 74, and maybe they'll get better when the tests are finished. Pfizer, of course, and the Moderna ones are at 94. But I think what we need to first agree on is, let's get the vaccine, let's get access to it. There's the Chinese vaccines that are coming down the road, which I think are also going through the WHO certification, CDC certification processes, so that we will have enough of them that we can look at. Now, the third thing that we're looking at least as the Economic Commission for Africa as well, is to say, yes, we want to get the vaccines, but 43% of all vaccines in the world that are produced are consumed on the continent. And only as of now, only one country used to produce vaccines, and there's the polio vaccine, and it was Senegal. And so if we are going to be consuming that much of the vaccines generally, why aren't we producing vaccines on the continent? Why aren't we creating our own jobs? Why aren't the Professor Stanleys of the world and the, working with us to sort of say, we have the know-how, we have the big business that can come together. And again, working with Afri-Exim Bank, we're saying, can we, Johnson & Johnson is going to produce 300 million vaccines in South Africa and ship them to the United States. Why are we doing that? I think that we do need to begin to ask ourselves those questions when we're talking about jobs, we're talking about our youth, we're talking about the talent that we have on the continent and outside the continent that can come back to help us. So I think as we begin to talk about the vaccination conversation, we must begin to talk about the production conversation, the localization conversation, the benefiting and scaling up of the AFCFTA conversation. And that's again where I think at the Economic Commission for Africa, we're working to see whether we can create vaccination production hubs across the continent, in the north, in the south, in the east, and in the west, and make sure, there's some fantastic women in Kenya that are pharmacists and are in the business of healthcare. And I think we need to bring them to the fore. We need to make sure that they have access to the resources that are going to be needed for them to scale up. So for us on the economic side, we think that there is a road, there is a track, there is a way to getting to vaccines on time with resources that can and should be mobilized sufficiently from outside, but also on the continent, we must put our money where our mouth is. And we can not only expect the external community to fund us, but I think some of our continental institutions, Afri-Exim Bank, African Development Bank, Trade and Development Bank, must come together to see how we can ensure that Africa gets the vaccines on time to get its economy going again. I will stop here and open it up for questions. Thank you very much.
Thank you very much, Vera. Thank you, passionately put, and also challenging us in terms of what are the issues that are relevant if we're going to make the economic case. We need leadership, and it's not just leadership within Africa, but it's leadership across Africa, Africa Union, Gavi, international communities. We need that leadership to make the case so that we are not expecting the vaccine in 2022. We need financing, of course, which is part of the reason why this particular special session was set up. But you're also saying, yes, financing, well, we're just going to continue to buy, but we also need to have local production. And I'm glad that you mentioned one of my countries in West Africa, Senegal. And it's not only polio, they're also doing some yellow fever vaccine. So, Institut Pasteur Foundation in Dakar, in Senegal, is really doing a lot. And any of us who have the opportunity should be supporting such local, regional pharmaceutical manufacturing companies. And that is one of the things that we are doing as part of West Africa Health Organization, to put in seed money into the vaccines that they can produce. But let me just ask you a question. In your conversations with partners and with people who are, of course, discount, if you like, financing of vaccines for low and medium income countries. Before you joined us, a similar question, I think, was posed to Strive. And Strive was really saying that in his own discussions, they were simply engaging on getting the vaccines access. But, as our executive secretary for the Economic Commission, this is a valid question. I think we have to hear your views on.
Oh, sorry. The question was, what are our partners? Can you just ask the question again? I missed it. Sorry.
A question of asking, what is the appetite for low-cost vaccines for low and medium-income countries? And of course, the vast majority are in Africa.
Listen, we have to give credit, first of all, actually, to the United Nations, to WHO. There was a big conference that was held with the United Nations on the presidency also of the European Union and the president of the European Union, to see and ensure that, there was equitable access to the vaccine. This started, so I think this conference happened in March or January, March, April, May, somewhere around May, June. Of course, it's a laudable cause, but then, when our economies start locking down, and we've seen in the United States, in the UK, then it's like, give me first and I'll think of everybody else, right? It's sort of, and I think that's where institutions like ours, institutions like the United Nations, must continue to remind the world that if any one of us continues to have this, carry the COVID-19 virus, all of us have it. So there must be equitable distribution. And I think that's why there was then, a global panel and global commission that was formed that said, well, let's start with the elderly and let's start with the caregivers. And this was sort of almost an international acceptable, start point, because we can't produce, the 7 billion vaccines that are needed tomorrow morning. So there has to be some kind of, okay, how are we going to give it? Of course, at the end of the day, the governance of how the vaccines are going to be used on the continent, and this is so, so important. When you talk about governance and you talk about our continent, you see where I'm going. We don't want the people who can afford it, yesterday I was listening to Bill Gates, and he was asked them, are you going to get the vaccine? And he says, I'm going to wait my turn. I think on the continent, we need people to wait their turn. We need governments to be transparent when the vaccine finally comes. Now, there is a new US administration. We're also talking with them. We're hoping that they can give us additional financing and additional resources for the vaccine. But I must say that, from the experience of the PPEs, we saw resources for PPEs come onto the continent, and we saw them not necessarily being well used. We saw those stories across the continent in many countries that will remain unnamed. And I think it's beginning to become important that Africa step up its game on governance. It's very difficult in an environment where Europe, the United States are suffering from job losses, high debt crises, to be thinking of giving monies to economies where the use of those resources remains non-transparent, where the governance processes are poor, and where the sort of results of an efficiency of the resources are also not very good. And then we start talking about how do we then help you cancel your debt. And so we do need to become, and I think what the Johns of the world are showing is, we have the skills, we have the quality to do this right. And so the plea for leadership is, one, let's have leadership to go get the vaccine, but let's have leadership to ensure that the governance processes for using the vaccine and for administering the vaccine once we get the resources for it are actually sufficiently transparent, and that our populations then begin to see the benefit of it.
Vera, thank you so much. And it's really, what you have said, and very passionately, is something that resonates extremely with us, because the issue is that if we don't start maximizing the value of every dollar, even the ones we have domestically, the ones we have to contribute domestically, if we don't start maximizing it, then we might as well pack up and go, because we'll get the funds. And if we then look at the funds, not only the waste, but the leakages, I mean, it is like John was saying, the issue of HIV drugs and all that was a question of morality. But actually, the issue of applying funds judiciously with prudent governance is also a question of morality. And, we really, it's criminal for, and I'm sorry to use such strong words, but this is a question of life and death. And therefore, every penny that is diverted is probably somebody else that will succumb to this pandemic where the vaccine doesn't reach. So thank you for putting it, in such economic terms, and really, really grateful to you. If you have time to stay with us, fine. If not, we will send you some of the questions. I'm sure you may wish to look at them next. I now need to thank you so much, Vera.
Thank you again. Thank you. Thanks to all of you for all the work you're doing, and we'll continue to work together. Thank you.
Thanks, Vera. Dr. Mohamed Ibrahim will be our next contributor. He's an economist in the technical office of the Vice Minister for Finance in Egypt. He's an economist who has also a PhD from Al Shams University, has been working in the ministry for a long time, looking at how you analyze economic issues, both interdependent and international economic issues, using statistics. He was representative of the Arab Republic of Egypt in the Committee of Finance of 15 Ministers of Finance, called the F-15. And also, although he started his career as in the Ministry of Finance in September 2013 in Egypt, he continued working and learning, as they say, it's what you learn when you know it all, in order to achieve his PhD in 2015, 2 years after starting work in the ministry. He has a number of published papers, and it would be a delight to listen to you, Dr. Mohamed Ibrahim. I'll call him fully Mohamed Ibrahim so that we don't confuse you with Mo Ibrahim of Africa also. Over to you, Dr. Mohamed Ibrahim. Thank you. Dr. Ibrahim, your microphone is muted. Do you want to unmute your microphone and then we can hear you? If he's having difficulty, can the host from Africa CDC please help unmute his microphone for him? His video is on, but we can't hear him.
So, sorry, Professor.
You're welcome. You have the floor. Thank you very much.
Yeah. Can you hear me now?
Yes, we can hear you clearly. Thank you.
Thank you, Professor. First, allow me to extend to all the participants a greeting of His Excellency Dr. Mohamed Maït, the Arab Republic of Egypt Minister of Finance, who couldn't be with us today due to his busy schedule. At the beginning, I would like to recognize the presence of Honorable Ministers of Health, Finance, and Her Excellency Amir Al-Fadel, EU Commissioner for Social Affairs, Her Excellency Dr. Riyas Ngoy, the Under Secretary General of the Executive Secretary Recognition Economic Commission for Africa, Dr. John Nixon, the Director of Africa CDC, and Honorable AU Special Envoys, and the representative of African Union Institutes, all protocol observed. Ladies and gentlemen, allow me to thank the African Union Commission and Africa CDC and the Southern African Medical Research Council for organizing this important virtual conference under the theme Framework for Fair, Equitable, and Timely Allocation of COVID-19 Vaccine in Africa. In this critical and important time that the whole world starts its first step to defeat COVID-19 pandemic. Indeed, it's very crucial to bring together health professionals and researcher on public health expert and a policymaker to make sure that Africa receives its share of COVID-19 vaccine equitable and in a timely manner. I wish you stay hearing me, Professor.
Yes, we can hear you, but unfortunately we cannot see you. Your video is on. I hope you haven't got a laptop that is covered because we can't see you, but we can hear you very well.
Yeah, I don't know why it was working quite well, but you know, technology, I have.
Sometimes if the laptop is connected to a monitor and the laptop is short, then the camera will appear, the video will appear on, but we can't see you. But anyway, we are listening to you, so please go on.
Okay, thank you. Actually, what started is a single COVID-19 case in late 2019, spread across the whole world, presenting one of the most severe health crises with high social and economic cost. While its impact on the world health system, including fatalities, continue to rise, the economic toll is still unclear as the world faces unprecedented global reaction. COVID-19 has severely affected the health sector and Africa economics. Contracting is mainly as a result of export adjustment affecting primary commodities export and the attendant loss to tax revenues, which reduce the capacity of government to extend public service necessary to respond to the crisis. Aside from the adverse impact of the COVID-19 crisis, the crisis illustrates the corresponding economic benefits that could be potentially occurred from the collective coordination to accelerate the development and deployment of tools that can rapidly reduce the risk of the severe COVID-19 disease globally. The access to COVID-19 Tool Accelerator, ACT, initiative or the global collaboration to accelerate the development, production, and equitable access to a new COVID-19 diagnostic, therapeutical, and vaccine, which was announced by the G20, introduced a good example of how the investment in research and development, especially in health sector, may lead to a great and positive economic result through shortening the period of the crisis. Such initiative could be replicated and help Africa to fight a number of endemic diseases in the continent, like malaria, TB, Ebola, and HIV. In this regard, the immediate coordination of health-specific response and revamping expenditure on health system by African government remain key in theoretical spread of the virus in the continent. And this should be augmented by debt moratorium and increased inflows of other foreign assistance to ensure the availability of resources to fight virus, especially in low developing countries. On the other hand, the coordination and cooperation between public and private sector are very important to mobilize the healthcare system in Africa. And in addition, African countries should give special attention to support the pharmaceutical industry and increase the cooperation between the African countries in research and development in this field. Lastly, in the future, the implementation on African continental free trade area will play a crucial role in diversifying African economies and help to shield them from global commodity price volatility that have continued to dictate the direction of continental trade and economic progress. At the end, I would like to stress on the importance of holding such a meeting, which bringing together experts in health sector, economists and ministers of health and finance from all over the continent to address how to improve the health care system and eradicate endemic diseases in Africa, since without healthy people, we cannot achieve the sustainable development, prosperity, and Africa that we want. I thank you, Professor, for the opportunity and for your kind attention. Thank you very much.
Thank you very much, Dr. Ibrahim, and sincere apologies about the slight technical issue there that we couldn't see you. But you actually, we heard you clearly. We heard your contribution about the fact that actually started from one case, but then the whole essence of the pandemic and the impact that it has had on economic growth, but also not just the impact on economic growth, but the fact that if we use the ACT, the tool accelerator, that may in itself also lead us to improve in terms of local economy through local production. And whether it is to do with the diagnostics or to do with the vaccines as proposed by the G20, but that you are really looking at us almost, I mean, these are not your words, but you know, if I may paraphrase, it's really a question of not letting any crisis go to waste, and let's see how we maximize the poor situation we find ourselves in. Thank you for your contribution. At this point, I would permit me to invite somebody who I have really a great fascination for his career, and somebody who I have not met yet, but I have met some of his people. Professor Benedict Orama, who is the president of Afreximbank, has worked in Afreximbank for a long time. Previously was in Nigeria Export-Import Bank. But I'm fascinated because he did not only his first degree, but also his PhD at the University of Ife. Professor Benedict Oke Orama, if you know what Oke means, it means he's from the Igbo-speaking part of Nigeria. And he is also a leading player in the implementation of the African Continental Free Trade Agreement. And we're really very keen to listen to you because your bank is well positioned to some of these innovative financing mechanisms that we're thinking of, not just for the vaccines, but beyond the vaccines, pharmaceuticals, and actually local industry in Africa. Professor Rama, over to you. Thank you. I'm afraid I cannot see Benedict online. Professor Rama, it looks like he's not with us at the moment, and therefore we will have to move on. And in moving on, I actually would wish to have a contribution that is almost like getting all the four people that are going to speak next to contribute together before we take questions. And I say this simply because their roles are, well, at least three of them, their roles are slightly interrelated. And I'm talking about the Africa Union envoys for international investment and financing, COVID-19. And so we have with us our own dear sister, Dr. Ngozi Okonjo-Iweala, who will be following the events of where that is at the moment, but maybe Dr. Okonjo-Iweala, you may let us know, but we are really hoping that with the change of major events in a particular country that we will not name, your candidacy and your leadership of the World Trade Organization will be affirmed very shortly. Ngozi Okonjo-Iweala is chair of the board of Gavi, the Vaccine Alliance, and of the Africa Risk Capacity. Also a co-chair of the Global Commission on Economy and Climate. She was appointed earlier this year as the AU Special Envoy to mobilize international financial support for the fight against COVID-19. And she's also a doctor we have just been talking about. She used to be a two-time minister in Nigeria, initially as a finance minister, and then later as a foreign minister. And she's worked a long time, over 25 years at the World Bank. Ngozi, I met you for the first time during the Orlando Awards, and it's great to see you again. But before you make your contribution, may I crave your indulgence to also introduce Trevor Manu. And after Trevor Manu, Strive does not need to be introduced. Strive Masia, who has already spoken to us, but Strive may also contribute during this session. And in addition, we also have Tijan Thiam, one of us, but also Tijan, who has was in the leadership of Prudential for so many years and is a key African in making waves in Europe. Trevor Manu is also an AU Special Envoy for COVID-19 response. He is the chairperson of the board of Old Mutual and was appointed an AU Special Envoy, just like Ngozi, to help mobilize financial support for Africa in the fight against COVID-19. Currently serves as non-executive director and chairman of Rothschild, but he has also been previously minister in South Africa. And so we really have the cream of Africa in terms of the economic aspect that are going to help to contribute to this. And then finally, we'll also want to have a few words, but I will call on you from time to time, from Strive Masiwa again on this particular topic, and also from Tijan Thiam. So first of all, Ngozi, Dr. Ngozi Okonjo-Iweala, ma'am, over to you. Thank you. Okay, thank you. My team, they tell me that Ngozi is also not online, although we're expecting her in about 3 minutes. So hopefully she will come online. I don't know if, yes, I can see Trevor. Trevor, may I please impose on you to go first then, because it was going to be a round table discussion. Over to you. Thank you so much.
Thank you very much, Prof. Kolo, and may I greet everybody and thank the conveners, because I think that ensuring that we have a strong, resonant African voice at this particular juncture is so fundamentally important. A couple of the key factors that we've had to deal with over the period. The first is that there's, in terms of the African continent, the decoupling between the severity of the pandemic and the economic shutdown effectively that has hit virtually all of Africa because of the nature of the African economies. And the economic pain will be felt for some time because of the nature of the economies, the dependence on issues such as tourism revenues, remittances, and so on. It's going to be of long duration, and so I think that speaks to the immediacy of the demand for a well-coordinated campaign of vaccines. The second point I want to make is that we must ensure that we can improve on data collection and data availability, and I know the CDC does an incredible job in this regard, but there are still a number of anomalies that appear. If you look at South Africa, where I live, we account for 5% of Africa's population, 36% of the infections currently, and 46% of the deaths. Now, what accounts for that? And I think that there's the data science is not very well developed. but it does speak to the need for us to coordinate. The third issue, and I know that Strive touched on this earlier, is the impact of vaccine nationalism and the cruelty of countries. And we thought that they were friends, such as Canada, that have purchased sufficient vaccines to inoculate each person 6 times when we know what the African need is. And so we need to ensure that there's a voice that deals with the lack of equity at a global level. There's an issue that I think we aren't giving adequate attention to, and that is intellectual property rights within the discourse. I mean, we still talk of the Pfizer vaccine, Pfizer Moderna being the most expensive, and we don't know what is coming. We haven't even properly costed out some of the alternatives available, but it's fundamentally important that we do this work and factor this in. I know that Strive in his meanderings has built up a remarkable collection of data in this regard, but we've got to nail this to ensure that we can have Africa serviced in a way that provides firstly maximum choice, but because we don't know. We can talk in aggregate terms about vaccine efficacy, but there's going to be the need for some bespoke solutions with vaccines. I think we also need to ensure that we can have maximum efficacy and lowest cost solutions. But then it's quite important that even in the African, in the context of Africa, and just to amplify what Vera said earlier, we can't have a nationalism here either. Securing the vaccines, I think, is the first part of a major challenge. We need to ensure that there is at least common policy, and talking of the broad approach that includes frontline workers, the aged, and so on, is fundamentally important. But who is looking at how this will be administered, and who is looking at the logistics? Earlier today, reference was made to the scale of military operation in the United States to ensure that within 24 hours they can get the vaccine into each of the 50 states. Well, what is the African solution? And that is being led by the Pentagon. What is the African proposal for the distribution to ensure that there aren't time lags in the logistics that gets vaccines to people at the lowest cost? And fundamentally importantly in this regard as well is ensuring that we have adequate public-private partnerships. In the US, I mean, healthcare is largely private sector driven, but Africa has a very different tradition, and part of the African tradition deals with the reality of health as a global public good. And so therefore ensuring that our health ministers, finance ministers, and governments in general are all in alignment in these issues becomes key. And I think in the same way as you said earlier, Prof, it's the decisions that should have been taken yesterday and the day before. We need to resolve the logistics of how we'll get the vaccines to ensure that in the time lag, the people who have the smallest voice aren't ignored in the process. Because unlike the developed economies of the North, where frontline workers are known to be in one place or in some places, and the aged are in care institutions, the dispersal across the African continent is very different. And we need to ensure that the logistics are in place so that the vulnerable are treated. And the reason why we need to drive this program very hard is because we must avoid the fiscal or the general economic cliff going forward. And this means that understanding that the reality of the decoupling of the economy from the severity of the pandemic is one aspect, but we need to get our economies up and running, and we need to do so urgently, because part of what we are seeing as Africans is that we are essentially on our own. Sure, there's been the commitment from the World Bank and others to assist in financing, but essentially we're on our own. and we've seen that you know, in the past we could look to Europe for various things. Europe is looking at Europe. Europe is oversupplying Europe with vaccines, and Africa is the forgotten continent. But we will remain forgotten unless there's a strong and resonant voice, not just on vaccines. And let me be impolite and say it needs to be uniform to include the tough political decisions. In our lifetime, Africa has never faced more challenges of peace than right now. And we thought that the adoption of the Constitutive Act of the African Union and all that came with it would produce different outcomes for future generations in Africa. What we're living through at the moment is actually a profound tragedy. It's a tragedy in the lives of people where it happens, but it's a tragedy because it diminishes the potential voice of Africa to speak to the world about our collective needs as Africans. And part of the message that we must get through is that we must be able to transcend the national borders and be able to have a single campaign that services the needs of all Africans. Whether you happen to be in Ghana, Burkina Faso, the Central African Republic, Kenya, Eswatini, or South Africa, it doesn't matter. We must be able to ensure that we are all treated as equals, and there will be no queue jumping when it comes to the vaccine. The point that Vera makes about Bill Gates must apply to all of us, ordinary people and leaders alike, and ensure that we wait our turn in the queue. But we must get the vaccine to ensure that we can trigger the economic recovery that is so needed on the continent. So, and finally, I want to plead for one thing, and that is that we have credible communications by leaders from the African continent who will put national interests aside. And it's very hard. It's very hard for our leaders to say, well, forget about the fact that I'm president of this or that country. We need a strong, resonant African voice that communicates to the world about the urgency of now, that draws on the lessons even of the immediate past, because the work that was done on the debt suspension sustainability initiative is minuscule. The funding of the vaccine is much, much greater. We don't have sufficient resources on the continent. We need a collective voice to be able to campaign and ensure that we can get through this urgently. Thank you very much.
Thank you very much. Thank you very much. And I do apologize in the first instance because I have just had a power failure where I am. So you might not be able to see me, but I'm certainly still with you. And I hope you can hear me. I will try and see if I can. Yes, I hope you can see me a bit. The joy of Africa, hooray! Yes, try and strive. But you make very good points, Trevor, about how to ensure we don't lose sight of the fact that the severity of the pandemic is one thing, but the economic pain is another thing. And then you went through some of the key things we have to be thinking of, whether it is to do with data collection, lack of equity. We haven't even mentioned, as you said, international property rights. And also, what of the issue of logistics? How are we going to get, I mean, John Nkengasong also mentioned it in his first introduction when John was talking about the Coca-Cola aspect. Even in developed countries, United Kingdom, you know, because of the vaccines and their need to be stored at -80, they can't even get it to their rural areas. So they had to resort to using hospitals, but now they have a way of supplying to some named hubs, and then, but it will only be issued for 2 to 3 days at a time. But you said one thing that really, really resonated, and you said the greatest challenge of peacetime for Africa is what we are in now. I think that is really something that we have to all think of and let it be at the back of our minds. In fact, at the front of our minds, not necessarily the back. Because you then went on to talk about the challenge of sovereignty versus, the Africa-centered approach, what John was talking about. Because if this is the greatest challenge of peacetime for us in Africa, how do we face it except by facing it as a group? Thank you so much for your contribution. And obviously there are going to be questions, and I hope to get the questions towards the end. We have about 50 minutes more to go on this, and I hope that maybe if we take 30 minutes to take the next 4 contributions, we might then be in a position to have at least 20 minutes to have discussions. And I come back to you, Strive, because I know that this is an area where you would really, you have some things to add for us. And one of the questions that had come up for you that you may wish to contribute on in terms of your further contribution on this particular special session is, are there any gaps? Because when you were talking about buying off those who have hoarded, using the word hoard, some of these vaccines, are you saying to us and to the listeners and to Africa that yes, we have enough funds now to cover the whole of Africa, if only we can find the vaccines? But over to you, Strive, if you may please take about 5 minutes or 6 minutes to make further.
I'll be brief, and I really hope we have a recording of what my brother Trevor just said. I have listened to Trevor for more than 30 years, since he had lots of hair, and I had even more hair. But that was truly one of the most profound comments. And I really urge the leaders that are in this room and all who are listening to review what Trevor said. Apart from the issue, all I want to say is this: apart from the issue of the supply side of vaccines, my greatest concern is what Trevor just pointed out. In our analysis, we need about at least $4 billion to deliver the vaccine. This is a massive exercise, colleagues. Don't underestimate the scale of what needs to be done. This is not like vaccinating kids outside clinics, For us to vaccinate this number of people is going to take a major exercise. And we all let's not be so totally absorbed with the need to get vaccines. We are going to get them. The big issue is getting them early enough. I believe we're going to get vaccines, such that we need to be focused at a national level on the requirements to vaccinate on this scale, to receive, to manage, to distribute, to collect the data, all that machinery on the ground. No one can do it from outside. No one's going to do it for you from outside. Gavi can't do it. We all can't do it. It's got to be national, okay? And it begins with an immediate recognition that we have a major, major exercise ahead of us, okay? And it's going to require, shall I say, military type precision, but I'm not calling on the military to do it, because that too would be a disaster. We don't want people to approach vaccine through soldiers and things like this, because that creates its own problems, okay? Then we just have to deal with the disinformation. The disinformation around vaccines is going to be itself a major problem. Because there is a global campaign going on, and our people are being drawn into that global campaign, okay? And it goes through everything. It's religious, it's just got everything, okay? And getting past it is not going to be easy. So at national levels, we now need to be coordinating with the Africa CDC, our partners at Gavi and so forth, but it's going to take a lot of leadership. I'll stop there. I see my dear sister has joined. Everything I know, I learned from Ngozi.
Oh, wow.
You wanted to learn more.
Right, don't exaggerate my importance, please. I don't know who's learning from whom.
Thank you very much, Strive. Thank you very much. And may I first make some apologies before I introduce you again, because I had introduced you in absentia, thinking that you were online with us. But thank you so much for joining us again. And I'm not even good enough to summarize what Strive has said, but I think Strive is just giving us that challenge. It's not just a question of finding the money and finding the vaccines. We will find it. We, of course, have to ensure, like Vera said before, and Trevor also, that we make sure we don't find it in 2022, but we have to have it now, or 2021. Now, but even if we do, how do we deliver it? How do we individually in our countries ensure that we have gone through that logistics of delivering it? And thank God that WHO also has a baseline assessment tool for people to use in ECOWAS, in WAHO, or West Africa. We've been using it, going individually into each of our 15 countries to identify where some of the issues are. And it's amazing what variation there is. And yet everybody is very keen to get the vaccine, but are we really ready? Thank you so much for that. And so I go back to, although, by the way, I'm not quite sure you specifically answered the question, Strive. The question was, are there any gaps in funding, if you remember?
Look, if you are the US government sitting on the other side, and I hope they're on this platform, I would be saying to the President of the President-elect of the United States, sir, we have massive funding gap. To be honest with you, as much as I love Dr. Muhammad Pate with his money, my brother, Professor Orama with their money, I would rather we didn't have to take their money. The economic pressure that we already are under, which my brother mentioned, the collapse in revenues, we can't afford to be borrowing money for this, okay? So do we have a funding gap? Yes, $9 billion. And we need donors to step forward and do it. But we've seen the numbers of what they have so far committed, and it doesn't take us even past the 20%. So yes, there's the funding gap, and we would love to see the US and many others step forward, not to lend us, but to help us. You know, we were doing pretty good. This is not of our own making, okay? This is not a crisis of our own making. So, you know, we need help. So there is a funding gap, my brother.
Thank you very much. Thank you very much. And in fact, it's not only for the vaccines. We did a little analysis looking at some of the funding that came in to fight COVID-19 in terms of diagnostics, PPEs, masks, and all that. The funds that came in from abroad, the vast majority of them were actually loans rather than free grants. And so people still have to pay for those, in addition to now, if we take loans freely for the vaccine. So, but that is a discussion that I'm sure will continue. Dr. Ngozi Okonjo-Iweala, in your absence, I introduced you as saying that those who might not have known, I'm sure many people on this listening to this would know about the recent events. Those who might not have known you would know about the recent events, and that I don't know where that is today. Maybe you have some announcement to make for us, but if you don't, we are still extremely pleased that you're here, and we know that we will hear at some point, given the change of government that we're anticipating in one of the major countries. However, you are the chair of the board of Gavi, and we are really pleased to have you to contribute on the investment case for Africa for vaccines. You're also the co-chair of the, you're also the chair of Africa Risk Capacity. And I really don't understand why not many more of our countries are participating in Africa Risk Capacity, because it's almost like paying a premium for pandemics and for a crisis. But you have been a two-term minister of Nigeria, initially the finance minister and then later the foreign minister. You've spent over 25 years at the World Bank, and you were recently, of course, appointed as Africa Special Envoy to mobilize funds and WHO Special Envoy for the ACT Accelerator. Ma'am, I think I met you for the first time. I've met you 2 or 3 times, but the first time was at the Olandiwo Honors Award, and I will want to remind you of that. So it's great honor to be here chairing this session and to listen to you. Over to you, Dr. Ngozi Okonjo-Iweala.
Well, thank you so much, Prof, for having me. And I do apologize for coming late. There were 2 reasons. One is technical problems. I don't know if people know that Google was out this morning, and that created a lot of difficulty. But before that, I was actually at a meeting, which I thought it would be important to listen to some of the things that there would be of importance to what is happening here. Now, I see my brothers, you know, are all here. I've got Trevor, I've got Strive. I can see them, and I'm sure they've said all there is to say on this issue. But just to add on the vaccine side, first of all, because this is the momentous thing, I listened to Strive saying that it's on us. No matter who we have helping, we have to be ourselves prepared nationally. And I couldn't agree more with that. But that being said, I just wanted to add that there's a very strong sense in the international community about this issue of equity and access. A beginning realization that this vaccine nationalism, which they've all jumped into, where rich countries really went out to try and acquire many more doses than they will ever need, that this is not going to save them, that even if they vaccinate all of their population, if there are people outside who are not vaccinated, it could still lead to troubles for them. You know, this, I'm not a physician, but you can know this thing mutates, you know, it can come back if it's still there in other countries. And so there's a realization that this doesn't work. Now, for these reasons, this morning I was in a couple of sessions with the international community on this issue. The first piece of news is that on the side of the COVAX facility, we are close to signing, or I mean, finalizing MOUs for about 700 million doses. You know, with AstraZeneca, with Pfizer, we are talking to Novavax and Moderna and all that. I think so. So the fact that we are going to get this, the issue now is exactly when. Are we going to be able to get this at the end of January, as some of us are hoping, so that we can begin to also deliver? We can't get them in December, that's for sure. Not even beginning of January, I want to be very clear. I think the discussion now is, will we be able to get some that we can now start distributing to some of our countries, I should say, for frontline workers to begin with by the end of January. I think that is what is being discussed. And there's a hope that at that time / beginning of February, we'll begin to get some of these doses. I would also say that some of the manufacturers, you know, like AstraZeneca and Pfizer, are very conscious of the fact that they also don't look good if all of their doses are going only to rich countries. Not all the manufacturers and vaccine developers have the same conscience, but some of them do. At least 5 or 6 have come to us saying that they want to make sure some of their vaccines get to. So there's some hope. I don't want to hype it. You know, so that's one thing. The second thing on the supply side is the fact that some of the developed countries have ordered doses that are 4 to 5 times more than what their populations need. And they are again coming to the realization. And a couple of them are coming and talking to us, because the idea is that they are willing to pass some excess doses. That conversation is on now. to bring through COVAX facilities so that we can also make sure it's equitably distributed. Some of them want to just give to some countries that they're affiliated with. But the realization is coming that this would lead to great inequity, because it means if you're my favorite country, I give it to you, and the next country next door doesn't have, and that doesn't help anybody. So the conversation now is how can we bring those doses that are going to be excess for them of the same vaccines. I want to be very clear. We are not there accepting doses, that are inferior or they don't want to use. It's just like Canada, for instance, has ordered 4 to 5 times more than what its population needs. The UK, the same. Some of the European countries, the same. And there's a willingness to share this at the same time they're getting it. So how we now channel all that through the COVAX facility. But it made me very happy this morning at this meeting to hear that this is going to happen. So that is on the supply side. Now the issue is on the ground, as we say. It's one thing to have the vaccines, but you know that the Pfizer vaccine, many countries have made clear they cannot take this. We had a meeting of the 92 countries, poor, low and low middle income countries that Gavi and the COVAX facility are trying to help. And 23 of them only said they were ready to take the Pfizer, because they recognize they do not have the conditions on ground to handle minus degree, minus 70 or 80 degree vaccine. So they are saying, no, we don't want that. We want AstraZeneca. But only 23 countries said they are willing to take the Pfizer. The remainder say they can't handle it. So we have to be very honest with ourselves. Do we have the cold chain, the cold chain required to handle some of these vaccines? Are we ready? I understand, and you can tell me more, Prof, that only 40% of our countries are ready on the ground as we speak, according to WHO criteria, to receive vaccines. So I want to urge all of us on the call here that we really have to work hard to get ready, because if we are complaining we don't have the vaccines, once they come and we are not ready to receive them, then that is a big issue. And we are putting aside some monies from the money we collected in Gavi to try and help countries strengthen their health systems to be able to receive these vaccines. So I don't want to take up too much time, but I'm very anxious that our African countries not think of themselves or see themselves as second-class citizens, at least for the first 20%. After that, we can now begin to talk about the next 40% that Strive was saying, where we need to discuss the gaps. Lastly, we are trying to raise money. We've raised 2 billion now, which will help us get through the frontline workers. We are raising an additional 5 billion. We've been quite successful to try to, but this is the gap for next year. And that is just on the 20%. I'll leave it there and then I can answer any other questions. Thank you.
Thank you so much, Dr. Okonjo-Iweala, and thank you so much for your leadership, your passion, and your dedication to this effort, amongst others. But you talk mainly about equity and access, and that we really have to look at not only the supply side, but in terms of the, if we get the access, then what of the demand? We have to make sure that, the demand is there. You talk about the awareness, and you talk about the MOU that might give us 700 million vaccines, even though we're not entirely sure the timing, but you think the timing will be in the first quarter of next year. And so far of the monies that we think we might need, we so far have about $2 billion and looking for a further $5 billion. And you are absolutely correct in terms of the issue of storage. I mean, and for the vaccines that are minus 80, liquid nitrogen. And how many people have that? You start looking at that in even with COVID-19 diagnostics, we had to go on to GeneXpert platforms in order to get to decentralized testing. Some of our countries had testing laboratories only in the capital. And now we are talking of getting it to the rural areas where it takes 3-4 hours to reach. And then how do we move these vaccines? You're absolutely, these are the key questions that have to engage our heads of states. And I know that discussion is happening in regions, and also Africa CDC is driving it. In our region in West Africa, we are having a small group looking at that and making sure that we help countries individually to prepare, because as I said before, some of the data we've seen, you talk about the WHO 40%, but it is a bit distressing to see the discrepancy between countries, even within the same region. And so we have to make sure we drive this to the table of the heads of states and the presidents, because they have to tackle it. Thank you so much. One question that has come up for you, and that is a question that somebody was asking: what efforts from the perspective of COVAX and other funding vehicles do you think that they are right in terms of pushing this issue of communication and also the issue of national planning for vaccine delivery? Yes, we have tools, but as we know, the failure, well, not failure, but the difficulties of some of the risk communication with respecting the public health measures for COVID-19 pandemic, we know it's multifactorial. In some countries, it's because of a dislocation in trust between the leaders and the led. And in some countries, it is because of a cultural fear. And now we have all the negative social media and things from anti-vaxxers who really are privileged and living a life of luxury. But how do we ourselves tackle this? How do we, particularly for developing countries, for Africa? That's a question for you.
I think that's just an excellent question, just superb, because this is one of the big worries. Just to share with you a number I heard at the meeting I was before this, is that in many developed countries, up to 50%, according to surveys, of people are saying they won't take the vaccine, and because of this big anti-vax. So it's not only on our continent, everybody is worried about this lack of trust and the misinformation. And I think we have to really move mightily against it. And yes, you can get some help from outside. Tomorrow we'll be in a board meeting at Gavi where we'll talk about how we can help. We should communicate ourselves. How can we help countries to communicate, maybe resources to support and all that. But the actual communication has to be in country and not outside. And it's a question of trust. So I think, on our continent, we at least have the good values of having community leaders, of church leaders, of people we trust, maybe more than government. We need to rope all of these assets into communicating. We need a communications plan. Let me, at this point in time, say how proud I am of the work that is being done by the Africa CDC and all our CDCs, including our own, the Nigeria CDC. I think they're just trying. And I think they have to come out and use the instruments, but go beyond what they're doing now. How can we get our community leaders, our women leaders in the rural areas, our church and mosque leaders, our imams, to help us communicate that this is safe and that we should take this. We need leading figures who are trusted on the continent to also come out and talk about it. So what am I trying to say? Communications is vital. Each country should have a plan. It's on us. And they shouldn't just rely on government assets to do this. They need to reach beyond to those trusted in the community to help spread the word. And by the way, please, we need our young people on social media to start saying the right thing. That's one of my concerns. How can we reach out to our young influencers on social media so that they can also spread the good word? Thank you.
Thank you very much. And you're absolutely correct. One thing that sticks to me, because when I look at what happens across countries, was what happened in Senegal in March when the COVID-19 was coming. And there was a case of COVID-19 in a very religious area, and that could have formed nidus for rampant community spread. But actually, the president himself and the minister and the public health leaders went and engaged with this religious community in Tuba. And I heard that for the first time, I mean, that's what I heard, for the first time in many, many, many years, an upcoming festival was canceled because of the fear that that could form a super spreader event. And that was simply because both the government and the community leader and the religious leaders came together to say, based on public health evidence and science, this is a risk and we have to do this. And I am extremely proud of that. And there are also, of course, other examples of this engagement, but we need to do more of it. And one of the things that I also think we have to think of, and we as the leaders have to be talking about, is the issue of the cost of testing for COVID-19 for travel. We really have to make sure that we strike to all our governments. We are doing that here. It shouldn't be seen as a case of making money. It should not be seen, because then we talk and contribute to the same narrative that then makes it that people are not extremely happy about this. This is really important to us. There are several questions on the Q&A. We have about 20 minutes to go. I understand, and that is the apologies I have to make. First, that Professor Orama is not going to join us today. Benedict, it looks like he's held up. I also understand that Professor Thiam is on for tomorrow, not today. So I'm sorry about it. It's not on for today. And so we still have opportunity for further contributions and questions. If I go through some of the questions that we have had, there is a question from Professor Tomori, Oyewale Tomori. You know, he said, why are we surprised about the speed with which we might get vaccines? So why are we surprised that people are expecting that vaccines will take a long time? That after all, it's all part of the whole disruption in terms of society, where people with private jets can get to the West in a very short period of time, but whereas others will have to take a long time together. So he is really bringing the issue of society and what really we have to do to change mindsets. And that's one of the things that I think he's saying there. And then somebody else said, if Africa have got vaccines from donors, how can it be distributed equally? Why majority of African leaders are famous for not instituting governance? I won't use the exact words they used there, but that was one thing that Vera herself did talk to in terms of leadership and governance. And then there is a question about the plan for the private sector. May I please throw this to the panel? And I'm inviting the panelists to take the question. Where is the private sector in this? And we're talking about the private sector in Africa. What do we have to do to engage the private sector regarding the vaccines? I know that the private sector did a lot in terms of the fight, in terms of PPEs, diagnostics. How do we get them in, and what are your thoughts on that? Who wants to go first?
I think Strive should take that question.
Strive, you're still with us. I can see Trevor raising his hand, or were you scratching your nose? You remember what happens in auctions? If you do this, then you get it. So Trevor, and then after that, Strive.
Thanks a lot, Prof. I mean, I think it would vary greatly from country to country. One of the things that has happened in South Africa is that right at the start of the pandemic in March, initially the private sector convened into a single business organization, and there's been the formation of a solidarity fund, which has a number of ministers, a number of business leaders, and some trade union leaders. And the solidarity fund has actually raised a fair amount of money from the private sector. So it's gone through various phases. The first phase was assisting government with the acquisition of PPE, because not all PPE needed to go through the government procurement regulations and could be done more speedily. They moved on to distribute food in the first lockdown, and that was another issue that was fundamentally important. Solidarity Fund has also put together a resource to deal with one of the fallouts from the pandemic, which is actually gender-based violence, which is a deep tragedy that we need to talk about increasingly. And as recent as last week, the Solidarity Fund had committed to financing a chunk of what South Africa needs for the vaccine initiative. So it can work. I think there's a model that's very current. It hasn't been tested before in this country, but hopefully it's a model that can be utilized elsewhere. And when the commitments were made to Solidarity Fund, company branding and so on has gone out the window, and the only interest is the Solidarity Fund in the interest of the needs of people. So that's current. I mean, sometimes not many good things emerge, but this is one of those things which we can hold out, and I think try and get emulated across the continent. Thanks.
Thank you very much, Trevor. Strive, do you want to run with this?
Yes, I will. Sitting between two of Africa's eminent economists, I have to say this with a lot of caution, but the greatest economic stimulus we can give ourselves in the next 6 months is to get this vaccine rolled out. If we don't get vaccines rolled out, you know what is going to happen. Come June, when many parts of the developed world have vaccinated their people, they'll now start putting restrictions on our ability to even go there, let alone investment. They'll be, look, we don't invest in that country because they have COVID. We don't go there because they have COVID, and so forth. I'm not cynical, but we began to see it when the trend in do you remember when the trends went down and then suddenly there were travel restrictions? Only 3 African countries could go to Europe. Just for, we don't forget these things, We got to get this vaccine out, okay? And 20% isn't going to be enough. And I know the finance ministers are out there and think, okay, I can wait for the donor vaccine. And listen, let's just plan. Okay, if the donors don't come, let's take the money from the World Bank and Afri-Exim Bank and let's get people vaccinated, because ultimately it is the most important economic stimulus we can give ourselves. So I really must, I cannot understress the importance of this, okay? Let's not be. Now, let me talk about private sector. Well, first of all, the private sector, since the beginning of this crisis, we came to support and provide leadership. The entire group of us who are the envoys are private sector. Even some of those who have been ministers are today private sector people, okay? My brother Aliko Dangote leads a group in Nigeria. So the private sector have understood that they've got to provide leadership in the midst of this crisis to support the leaders, because they have assets and people on the ground. Okay, so that's one. Now, coming specifically to the issue of vaccines, we are fortunate in one respect, and Trevor didn't mention this, but look, one of the biggest pharmaceutical manufacturers in the world is Aspen in South Africa, who have partnered with Johnson & Johnson to produce the vaccine. That's an African company, and we're fully engaged with them, right up to President Ramaphosa himself, to make sure that they are able to produce. But unfortunately, as I said, their production only starts in December. But this isn't going to be a one-shot affair. Again, we don't know that. We don't know how long it lasts. Is it 2 years? Is it or more? So we may be vaccinating for a while. That's what the clinicians tell me. I keep asking them, is this one-off? It's not. Okay. So what does the private sector do? Okay, obviously, it's great to have a big manufacturer in Africa who could participate. And there are a lot of other players talking about this in Egypt, in Kenya, in Nigeria, in Senegal, and other places. So Afrexim Bank has put a facility of $500 million to support any company willing to step up and become a big manufacturer or a distributor. Okay, so the private sector could participate. But there's a lot of, in such a big rollout, I hope that governments will reach out to their private sectors to help them in communications, in distribution, in warehousing, in all manner of support. And I know that the private sector will not step forward because they want to make money. Okay, the best money for us is when we have a healthy Africa. Okay, and we will fight this disease because it's not good. Okay, we want to protect our workers, we want to protect our populations who are our customers. Okay, so we're all in as the private sector, but obviously we can't produce an mRNA vaccine, they call it, huh? That's a bit clever technology, but that's not to say we cannot find gaps and ways to help. So we urge the ministers to reach out to their private sector and see what role they can play in this major distribution work.
Prof, may I add something?
Please.
Yeah, I just to complement what my brother said and maybe comment a little bit on what Strive said. I think, honestly, we we have to be complimentary of the private sector in many of our countries. Like he said, they've stepped up. I know in Nigeria, they did put together a fund to try and help with acquisition of medical supplies and equipment. Strive forgot to say that he built this platform to help the entire continent under the with the President Ramaphosa and all the presidents. Maybe he talked about it earlier. So I think the private sector is coming forward. Now they need to do more, but we need to be very clear on what they can do and how they can help. Number one, they can help with logistics. I think the private sector is very good with logistics. So in making the vaccines available and distributing, we should be talking to our private sector about how they might be able to help us get these vaccines and the necessary cold chain that goes with it, help us get them where they are needed. I think that's a very good thing. Later on down the line, if there's a need to come up with more resources to go beyond the 20%, the private sector should also, be tapped if they're willing to help us do that. Finally, on the issue of the economics, Strive, I think your economics is not that bad. I think you should also give yourself another title. It is true that the economic impact of this will continue to be great as long as we don't tackle the health impact. There's absolutely no doubt about that. But what I do want to say is that one caution, in the rush to do this, please, we are also being offered free vaccines. I would urge all our countries to make sure the vaccines are certified by WHO to be safe and effective before we accept them. Because one thing that is going to destroy all the efforts, you know this, Prof, is if we get vaccines that we don't know whether they're safe or efficacious, in our rush to show our people that we are vaccinating like others, we take these, we vaccinate, and something goes wrong. Then everybody will refuse and reject all the vaccines. So no matter what, please be careful about accepting vaccines. Accept if they've been certified by WHO. If not, please go with those that have been carefully certified. Thank you.
Thank you very much. Extremely well said. And of course, as I'm sure people here know, the African Medicines Registration Harmonization Initiative, the MRH, is really going well in a lot of countries. And so there is that peer support, but peer pressure also, such that if one country goes off to do it, if it is not, first of all, it has to be certified by WHO, but we are also thinking of a way of speeding up the registration across countries and using the MRH in different regions, that does help, but also does bring in the check so that, you know, people in the region will say, look, this has not been approved by the regional body and the regional NMRs who've come together. Why are you somebody who is becoming somebody who's standing out in terms of an outlier? Thank you extremely for that. And the other thing I really need to, we have about 10 more minutes to go. And I want to bring up one question from the attendees, but also a question myself. I mean, from the attendees, they are saying, you know, several world leaders have called for COVID-19 to be sort of people's vaccine, public goods. And how would we, and particularly the panelists, go about supporting and promoting that at the level of the African continent? And let me just throw in a second question so that, you know, we don't have to all talk about the same question, all of you, so everybody can pick that up. And that is the issue of how do you incentivize the private sector from the government side? Because, you know, we've seen it, 10% projected growth, the pandemic came, 1%, 2%, and some countries in recession. It's now, this is not even anymore for the public health and the medical people to make the case of health as an economic investment. Everybody's seeing that it is really an economic investment. So the question is, how do you incentivize the private sector? Why is it only Aspen that can help at the moment in the fill and finish in terms of pharmaceutical manufacturing chain? Why are the other countries not helping with that? Some of the work we see in West Africa, but it's similar across Africa. I know I was speaking to one of the presidents from Tanzania, and similar thing they have is that 60 to 70% of our drugs are imported. We cannot manufacture. So why are we are fantastic in terms of banking, in terms of why can't we incentivize our private sector? So I'll leave those two questions for the panel. Who wants to start with the people's vaccine and how are we going to promote and champion that? Yes, Ngozi, over to you. And who wants to talk about the other issues of incentivization for health?
Yeah, thank you. Maybe I can tackle the issue of vaccines as a global public good. And the idea, what I simply want to say is yes, I strongly believe in this. We believe in this. Nobody should be prevented from having this vaccine because they don't have the resources. This is a key tenet. Now, of course, you know that those manufacturing and developing this invested billions of dollars in developing. That is the private sector who have been working on this. Some organizations like mine and WHO and CEPI also gave them or invested some money with them. Governments did, but at the end of the day, monies were invested. So some of the organizations are saying they can't completely give this free, they have to recoup. But many of them are willing to knock down the prices considerably. And that is why we thought that COVAX, that could aggregate the procurement for 186 countries, will help us to knock down prices considerably to a point where governments can now say, look, we're going to give the vaccines free to our people, if possible. Now, not all governments will be able to do this because of the fiscal issues. So we are still trying to raise additional funding to help those governments knock things down as much as they can. Because of this belief. Some countries are willing, when they have access, to donate the excess they have of the good vaccines, and this could also come as free. So the summary of what I want to say is the vaccines should be regarded as a global public good. We need to find some ways for the richer countries to help bear the cost for the development and production that private sector has incurred. So it cannot be completely free on that side. But if they are forthcoming, we should be able to get it at very low prices to our countries. And hopefully then people can get the vaccine without having to pay.
Thank you very much, Ngozi. Strive?
You know, as you know, Prof, I'm a businessman. And let me speak for a moment as a businessman would look at this. Africa, to achieve 60%, that 750 million people, at least 1.5 billion doses. Okay, if we were unshackled to call in the manufacturers who've been chosen by COVAX and said, listen, we're going to take 3 or 4 of you, okay, and no one else to supply the African continent, but we need you to start production on the continent within 18 months, I'd get it done. You just haven't given us the room to do that. Africa doesn't, if Africa acts together, it is strong. That's all. The market is there. But if we're just frayed all over the show, okay, that's why no manufacturing taking place. We're the biggest consumer of this product, and we'll remain just a consumer. But if we sat down and we said to these manufacturers, listen, we want production. Let's talk about your production plans, even as we are beginning to select you to come forward. The problem is we don't even have a say over what vaccines will come in. We're not in the conversation, okay? So we throw away our leverage, okay? That's how we as business people would attack this. I'm not in this industry. Are there Africans ready to invest if this opportunity emerged? Lots of them, okay? And I can give you a list, okay? But we have to create, that's the incentive, okay? The market is there, the opportunity is there, but we have to speak with one voice, okay? I'm glad that Aspen are doing something with J&J, and I'm hoping we will see 1 or 2 others emerge out of this crisis. But it will be really sad that a crisis like this, we don't emerge with at least the ability to deal with production on the continent as part of the legacy of fixing this one, okay? So it's out there, and we are entrepreneurs in Africa. Give us the opportunity. People will get this done.
Thank you very much. I don't know if you really, okay, yeah, Trevor, please. Trevor, your microphone.
Let me go back. Thank you very much, Prof. Let me go back to the question. You know, we need to remind ourselves what has happened in our lifetime. 50 years ago, 51 years ago, the flu vaccine was developed. Primarily, the R&D was done at universities. Flu vaccines are available. They're upgraded regularly as flu strains mutate. And essentially, it's a global public good. If we take pharmaceutical pricing, it is the most opaque element, because once you strip out the costs of intellectual property rights, the chemical costs and the production costs are actually minuscule. But we take it as though it is some God-given right that there must be price gouging. We saw this earlier in some large countries whose names we can't mention and so on. And there was price gouging on some of the steroids like dexamethasone and others when it was realized that these drugs actually can contain COVID. Suddenly, there were massive price increases. Now, the world needs a voice that recognizes that health is actually a public good. And that voice is not one that we can relent on. It's fundamentally important that we take this view, that we are aligned in this view. Doesn't take profit out of it entirely, but it limits the opportunities for price gouging. The other issue I think that we must talk to in the context as well is you know, the global macro situation is bad and it's going to deteriorate. And wealthy countries are looking at their own debt loading and so on, a lot of it new. And in the course of doing so, forget that we are joined at the hip and there needs to be some responsibility, partly because of what Strive said earlier. For 25 years, African states have reformed their economies. The gains were starting to come through, and now we've had this major setback. We don't have capital markets that allow us to borrow in country, and therefore you need a global effort that looks at these issues substantially differently.
Thank you.
Let's not relent. Thank you very much, bro.
Thank you. I think we are now at the end. I cannot summarize everything that you have all said. I am extremely honored and privileged to have been able to moderate this session. We have all heard from everyone. Thank you, John, you talked about leadership. Thank you, Vera, you talked about governance. Mohammed, you talked about the ACT Accelerator. Trevor, thank you for reminding us about logistics. Ngozi, you talked about the public good that this vaccine and give us a lot of information. Strive, you talk about the local production and the fact that we are ready to buy where it is and the fact that government should incentivize. I really cannot thank everyone enough. It is time, and may we continue these discussions tomorrow between 1 to 5 p.m. East African time, which is 10 to 2 p.m. GMT. Thank you. I have benefited a lot, and thank you for inviting us, Africa CDC. Bye.
Bye-bye. Thanks for being a good moderator.
Thank you, Professor.
Thank you.
Hi, Stanley. Thank you.
Thank you, John, and I will be on the phone soon.
Sure.